everyone. We will go ahead and get started. A copy of the Open Meetings Act is located on the wall in the back of the legislative chambers, as well as an automatic external defibrillator. Please stand for a Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. We will begin with the Douglas County Board of Equalization. Roll call, please.
Commissioner Mike Boyle.
Present.
Commissioner Maureen Boyle. Here. Commissioner Kavanaugh. Here. Commissioner Friend. Here. Commissioner Morgan.
Here.
Commissioner Rogers. Here. Madam Chair.
Present. The Douglas County Board of Equalization, approval of items A and B. Is there a motion to approve? Item A is the approval of the minutes of the Board of Equalization meeting held Tuesday, April 27th, 2021, and B is call for a meeting to set Tuesday, May 11th, 2021. Any questions or comments? Please vote.
I vote yes.
Voting yes.
Motion passes 7-0. Commissioners Mike Boyle and Morgan voting virtually. All other commissioners voting in person.
Item C, citizen comments. Is there anyone wishing to speak to the Board of Equalization about an item not on the agenda? Seeing none, we'll move to resolutions. There are two. Item D, approving application for tax exemption form 457 on motor vehicles. And item E, request for board to approve the treasurer's recommendation to deny application form 453 for vehicle tax exempt status. Is there a motion to approve D and E? Motion by Commissioner Rogers, second by Commissioner Maureen Boyle. Any questions or comments? Commissioner Mike Boyle.
Yes, I'd like to ask if on item E, if it's a matter of a veteran being unable to receive a disability. And I wonder whether, can we offer him help, or did we? I just want to be sure that we have exhausted all of our efforts on his behalf. Can we investigate that? We'll go ahead. I don't know that I want to deny it, but I wouldn't deny it until I know he's taken care of.
Commissioner, this is Amy Wyman from the Treasurer's Office. And we had talked to him several times, and he could not provide us with the documentation that with his disabilities, because he knew that he did not have the approved disabilities, but he just wanted to submit this to the board for the denial because he wanted the awareness of it, the situation.
Okay. Thank you for coming. Thank you for being prepared. I appreciate that very much.
Yes.
Thank you. Any other questions or comments? There was a motion and a second. Please vote.
I vote yes.
Voting yes.
Motion passes 7-0. Commissioners Mike Boyle and Morgan voting virtually. All other commissioners voting in person.
Item F, we do have one appeal of rejection of homestead exemption for Mary Yurkovich of 1523 Jefferson, Omaha, Nebraska 68107, and Mike Goodwillie is here to talk in detail about this one.
Good morning, Commissioners. Mike Goodwillie, Douglas County Assessor, Register of Deeds Office. This homestead application came in there we go, in kind of a piecemeal fashion. And so I can understand why the power of attorney for the applicant thought the denial was based on filing some of the paperwork after the filing deadline. That's really not what this is about. What we know is that the woman on whose behalf the application is being filed has been in a nursing home from May of last year and is currently there with some serious health conditions. And state law requires that to qualify for homestead, the applicant own and occupy the home between January 1 and August 15 of the year for which they are applying. And so based on our knowledge of her situation, this is what we sent. Here's the rejection. And as you can see, we denied the application because the applicant did not occupy the home, not because of any glitch in the timing. We have not heard anything from the power of attorney, who's one of the applicant's relatives, about the duration of her stay in the nursing home, but we know that at least as of the end of March, she was still there and her medical conditions appear to be rather serious.
Okay, thank you. Question, Commissioner Kavanaugh?
How does this come to our attention that she's not in the home?
Well, there's a space on the exemption application where we ask them if she's in the home.
And they checked it.
Yeah.
Okay. And how do we know that she's not coming back?
That is a fair question. But there it is, right there. Are you in the nursing currently?
Can't hear you.
I'm
What's
sorry.
that?
Can't hear you.
I'm sorry, I apologize. Yeah, okay. What? Oh, shit, I scratched it. Thank you. Thank you, Dan. I thought I made a copy. Here it is. I knew I was prepared, but right there it asks them, what date did you enter the nursing home? Have the household furnishings been removed? Is it occupied? Is it leased? There is a gray area in the law about, once you go into a nursing home, there's no really magic deadline for how long you have to be out of the home. I would say at this point we're coming on a year. And given her age and what we know of her medical condition, and we know about the medical condition at least a little bit because the Form 458L, which is the doctor's form for people to file after the June 30 deadline, the doctor went into maybe more detail than was even necessary about her medical condition. And those do not appear to be, I'm not going to stand here and claim to be an expert in elder medicine, but the conditions the doctor listed for why she was in the nursing home and why she couldn't file an application were serious enough to think that if that were my relative, that relative probably isn't moving back in the home.
Okay, thank you. Any other questions or comments? Commissioner Maureen Boyle?
This is probably due to my newness on the board, but if we don't approve this, does this just mean it goes up back on a tax roll, so there's no exemption?
That's if you approve the homestead application, or if you grant the protest, then yes, you'd at least grant the county piece of the homestead exemption. Now, what would end up happening is the application will go to the Department of Revenue, who will analyze the income information for the applicant, and they'll make a determination. You have to understand, homestead is means tested by both the value of the home, which is no problem in this circumstance, but also the income of the applicant. And for homesteaders, typically you're 100% eligible if you're a single applicant in the high 20s and low 30s for income, and you phase out by the mid 40s. And so last year, for example, these folks were 30% qualifiers based on income. So you would at least, if you approve the protest, or if you grant the protest, you'd be granting the homestead exemption, at least insofar as the county piece of it. That doesn't mean they're going to be 100% qualifiers. The Department of Revenue will look at their income. If you deny the protest, then yes, they'd get a tax bill for the full tax amount, the same as any other taxpayer that is in the homestead exemption program.
Thank you.
Commissioner Mike Boyle?
Yes, Mr. Goodwillie, do you have any information that shows the valuation of the home on 15th Street there?
I looked that up this morning because I anticipated that somebody would ask, and the 2021 value for the property is $90,000.
How much?
90,000, 90,000.
Would you venture a guess as to what that might produce in revenue for the political subdivisions? What do you think she would pay in taxes if she were paying taxes?
Well, I'm thinking the rate is a little bit north of is going to be a little bit north of 2%, probably around 2.2. So if I were ballparking it, it's $3,000.
Okay, so I wonder if I'm following on what Mr. Kavanaugh said. My thread is that whether or not she returns home is something that we don't want to necessarily guess. But I wonder whether we couldn't find some way to suspend this this taxation, not us, but we're going to have to maybe think about the state doing something, but suspend this valuation while this period is taking place of whether or not she's going back home and all that sort of thing, so that she doesn't have to go through, if she is able to return home, she doesn't have the problem of going all the way through the homestead thing again. What do you think? Is that overkill, or should we just let
Well,
as they
Commissioner,
are?
I think there's a couple of threads to what you're saying. One of them sounds like, well, okay, she's applied this year, and you don't want her to have to go through this and apply again. There have been some discussions over the years about applying once and being in the program,
No kidding.
and then staying in it. I think part of the reason that's never caught on with the legislature is there's too many incentives not to tell the authorities when somebody has moved.
Okay.
You apply once for Social Security and you get it, but of course you want to keep getting the checks. So when you move, you tell the government where to send the checks now, right? Well, with Homestead, if you say, well, the owner has moved to Florida, and now her daughter or her son or her grandson lives in the property, the family doesn't want to tell us, because then their reward is going to be a tax bill. So I think there are some sort of inherent incentive problems with doing that. I mean, it's a pretty idea to think about, but from a practical standpoint, I think there's too much temptation to.
And I agree with you right on point. I don't think there's, there's that sort of thing goes on. That I know it from private practice, and I just know it from around, but it always bothers me that, we force consumers, private people, to jump through hoops that we don't even think of telling corporations to do, that once they apply, it's perpetual, and so I don't know. I understand the problem, though. It's something that we have to work out. I guess we have to just take these one at a time. So thank you very much.
Commissioner,
with
just
all-
a minute, PJ. Just a minute, PJ.
Okay.
Commissioner Mike Friend.
Yeah, thank you, Madam Chair. Mike, thanks for the information, and I had brought this up yesterday, and this seemed like a weird agenda item to me because I hadn't seen it before. What I would ask is, and I don't know if I am asking you to give your opinion on this, but I'd like, I guess, a certain type of education on this. I think Commissioner Kavanaugh had actually brought up the idea that, to me, the concern that the worry that I have is the term occupying a home, okay? If this person still, if Mary still actually legally owns the home, I think occupying is a loaded term. How do we know, and maybe you answered this because Commissioner Kavanaugh asked a question, how many homestead exemptions are we providing to people who actually don't physically sit in that home? And how do we know?
The answer to the first question is we don't necessarily know about them all, but
Okay.
I think relatively few. There is the the form does ask them about, is their stuff still in the home? Are they in a nursing home? Are they occupying it? Are they leasing it out? So we do get some applications every year with people in that scenario. And depending on when they tell us they've moved into the nursing home and how long it's been, we will sometimes follow up, and we'll try and reach out to the nursing home, and we'll say to them, without disclosing too many details, without violating HIPAA and disclosing the nitty-gritty about the medical condition, is this person capable, of living outside the nursing home setting? We don't do it all the time, but when we have some that are starting to pile up, they moved in late last year and then they're filing again. So what we're trying to get a handle on is, do people actually live in the house? I mean, what Homestead was intended to do was relieve the property tax burden of that elderly widow who's been in the house that she and her husband bought 50 years ago, and the husband's passed on, and between the valuation of the market and the taxing and spending decisions of the local political subdivisions that set the levy rates, the taxes are rising faster than her Social Security check is rising. And she's living there, and that's what it was aimed to do. And that's, I think, why the legislature chose the term occupying.
Okay, well, I appreciate it, Mike, and that does help. What I'm struggling with right at this very moment.
What they want, I think, is you're actually living in the house. You're not a snowbird who spends 6 months out of the year in Arizona.
Yeah, no, fair enough. So what I'm getting at is, and I guess I agree with you, what I'm getting at is, and where I have an issue at this very moment, is not occupation, it's utilization, okay?
Okay.
Utilization of an actual property. So in other words, if Mary's sitting in God bless her, if she's sitting in a nursing home somewhere, and her family's leasing this property out or doing something behind our back that we don't know about, then that's utilization. It's not occupation.
Okay.
She still owns the home. She's just not physically there. What if something happened and they moved her back in there? So anyway, I digress.
No,
I'm struggling with this because
that's a fair point.
I think we could have this discussion every week, and that's what concerned me about this appeal item on this agenda, right, Mike?
Well, what happens more often than not is some relative moves into the house for free.
Yeah, I hear you.
So,
Mike, thanks. That helps. I appreciate the information.
Thank you, Commissioner Friend. Commissioner Kavanaugh, this is your second time.
And one of my concerns is that she apparently goes into this assisted living in May of 2020, and the situation with the pandemic is that it's almost like the Hotel California. You can check in, you can't check out. I have relatives, elderly relatives in assisted living. I can't visit them, and they can't come out. And so, her condition aside, she may be medically unable to return due to the pandemic. And I don't know if we investigate that, but it's almost like, I guess I'd be inclined to give her a grace period because of the pandemic, and she's in a facility that I'm pretty sure, like all the other assisted living places in town, have been in lockdown since May of 2020. Did we look into that at all?
That is kind of the X factor in all this, and that's a fair point.
Okay, Commissioner P.J. Morgan.
With all respect to Mr. Goodwillie, the taxes would be approximately $2,000 or a little bit less annually. The other thing about somebody moving
Thank you, Commissioner. I as I'm thinking about it, I recognize my error, and I don't know why I had the figure in my head that I had it, but I appreciate that. Thank you.
The other thing I'd say is oftentimes what Commissioner Kavanaugh said about being in that assisted living, you might want a relative to be at the home so it's not just sitting there vacant in these times, as just a precaution too, to keep things all going. So I think, it's worthy of our consideration of what we could do in this particular case.
Okay, thank you. I don't know if our county attorney wants to weigh in on this one. And again, just to clarify, Mike, you did just say yes or no. We did check with the physician about her medical condition upon potentially leaving the nursing
We
home.
received the 458L. Let me get my fingers on it.
Can you turn the clock on, please?
That describes her medical condition, and we received that as of I think we received that like the 2nd of April.
Okay.
And as of that time, the conditions that the doctor was outlining outlining were pretty serious, and she's still living there.
Okay, thank you. Teresa, as far as, again, yesterday, it was more of the application was late. Today, we're finding that it's, the person isn't even living in the home, which makes, I think, a big difference. Could you expound on that, please?
Sure. Teresa, York County Attorney's Office. And so we don't get to the late issue and the medical documentation until the person has met the statutory requirements for the exemption. And one of those requirements is that it is the wording in the statute is actually occupied by as such by a natural person who is the owner. And they have to occupy it from January 1 through August 15th. And we know from the documentation that this lady in May of last year left the home. And so she did not meet the statutory requirements of it says actual occupancy of the owner from January 1 to August 15th.
Okay, thank you very much. All right, with that, what is the will of the board? The item
Borges.
is to, Mike, you've spoken twice already.
Oh, okay, well,
Sorry. So but we just need to know what the will of the board is. The agenda item is the appeal of the rejection of homestead exemption. So what is the will? So Commissioner Rogers is making the motion to uphold the recommendation of the county assessor to reject the homestead exemption application. Is there a second? I'll second that.
Give us one moment, please, while we get the.
And does that include adjournment? Yeah.
Okay, we are ready. Thank you.
Voting yes, PJ.
voting no.
We're voting to uphold the assessor's recommendation, which is denying the homestead exemption application.
Okay. Motion fails. Commissioner Rogers, Borgeson, and Morgan. Well, Commissioner Rogers and Borgeson voting yes in person. Commissioner Morgan voting yes virtually.
Oh, okay.
And the noes are Commissioner Boyle virtually and Commissioner Kavanaugh, Maureen Boyle, and Mike Friend voting no in person.
Okay, thank you. And again, that did include adjournment from the Board of Equalization. We'll now move.
Well, maybe I misspoke, but the motion, it failed. It did not pass. We only had 3 yeses.
I make a motion that we adjourn, if I can.
Okay, but don't we have to, I think we have to dispose of the protest. Now, if the Commissioner Rogers' motion fails, means that the protest is granted, okay, but
That's how I took it.
but I don't know.
Well, I thought.
Well, Teresa, can you come to the microphone, please? So is that correct? Since the motion failed, the homestead exemption is granted?
I would say yes.
Okay.
We either have to grant it or deny it. I think it's not as possibly as clear as we could have made it, but those are the 2 choices. You're either going to deny it or you're going to grant it. And since the denial fails, that is in essence a granting of the protest.
Right.
And so, and we do need to do one or the other just so that they have the opportunity to appeal it. And so I would argue that you guys granted it by not denying it.
Okay, thank you. And that also, again, that motion also included adjournment. Okay?
Okay, well, so technically the motion to adjourn failed as well, but I guess we'll
Oh, well, okay, so.
assume it adjourned.
I make a motion we adjourn if I can.
There is a motion on the floor to adjourn. Is there a second?
Second.
Please vote.
Wish I was there. Something's going on.
Commissioner Morgan and Commissioner Boyle, Mike Boyle, how do you vote? To
I
adjourn?
vote yes.
Yes.
We're just laughing at you, Mike.
Oh, that's okay. I enjoy that. Thank you.
All right, motion passes 7-0. Commissioners Mike Boyle and Morgan voting virtually, other commissioners voting in person.
Thank you. We'll move to the agenda for the Douglas County Board of Commissioners. Roll call, please.
Commissioner Maureen Boyle, Commissioner Mike Boyle,
Present.
Commissioner Kavanaugh, Commissioner Friend, Commissioner Morgan,
Yes.
Commissioner Rogers, Madam Chair.
Present. Item A, approval of the minutes of the Board of Commissioners meeting held Tuesday, April 27th, 2021. Please note that the minutes from the pre-board meeting are also available. Item B is approval of the claims submitted for payment process through Tuesday, May 4th, 2021. Is there a motion to approve A and B?
Motion to approve.
We're going to have the motions and the seconds in person.
Okay, no
So-
problem.
Thank you, Commissioner. Commissioner Maureen Boyle made the motion and Commissioner Rogers seconded it. Any questions or comments? Please vote.
I vote yes.
Commissioner Morgan.
Yes.
Motion passes 7-0. Commissioners Mike Boyle and Morgan voting virtually, other commissioners voting in person.
Thank you. Consent agenda, there is items A through J. Please note that item I2 has been removed from the agenda. Is there a motion to approve? Motion by Commissioner Rogers, seconded by Commissioner Maureen Boyle. Any questions or comments? Please vote.
I vote yes. I vote yes. Sorry, PJ.
Motion passes 7-0. Commissioners Mike Boyle and Morgan voting virtually, other commissioners voting in person.
Thank you. We'll move to recognition and proclamations. Our first one is a resolution declaring May 2021 as Mental Health Awareness Month, recognizing the need to increase awareness and understanding of mental health and the accessibility to services for all people with mental health conditions. And again, I won't read the whole resolution, but just note that during this month, there's various activities that will be taking place, but I would just encourage everyone to build that awareness of mental illness, and this is coming at a great time, and when we just wrapped up our listening sessions, which were fantastic, and we'll have more on that later on, but it is an important month and would encourage everybody to, again, build that awareness of mental health in our community. With that, is there a motion to approve? Any questions or comments? Please vote. Oh, sorry. Go ahead. Come on, Larry. Come on.
Thank you. I think this would be a very good opportunity to talk about both A and B.
Well, just A,
Excellent,
please.
excellent.
Can you just stick to A right now, because that's
All
the
right.
item we're
But
on.
my point being, they do tie together. I've recently been attending a lot of events at American Legion Post. And the thing I notice most is there's very few younger veterans that go to these clubs and events and things that they put on. And a lot of it might be due to war injuries such as PTSD. But a lot of this mental health therapy thing is all very private. But we need to spend some of the money that we do give away to various community partners, helping support the VFW, the American Legion, and similar organizations, and encouraging our younger veterans, particularly those that need the camaraderie of people they are used to serving with, to get out there and do their own therapy and group get-togethers, maybe classes, maybe even some American history stuff and political discussion things. as a way of getting them out there and getting them used to being involved again with everybody. There's a lot of older vets there also. That's why I bring it up. A lot of older vets that really enjoy it. It's very good for them. And we need to help support those organizations as well as all of these other community partners that come before us for asking for dollars. Thank you.
Thank you, Larry. Any other questions or comments? Please vote.
Commissioner Morgan and Mike Boyle, how do you vote?
Voting yes.
Okay. Looks like Commissioner Mike Boyle's absent. Motion passes 6-0. Commissioner Morgan voting virtually, all other commissioners voting in person.
With that, we do have a resolution declaring May 2021 as Older Americans Month, recognizing older adults and the role they play in the well-being of our communities. And again, I won't read the whole resolution, but I encourage all of you to look at the materials that I did pass out. They are, the loose leaf one is just again, descriptions of services in which we provide through our Office on Aging, and the paper is our New Horizons. For those who don't know, this goes out from our Office on Aging on a monthly basis, and they usually highlight someone on the front cover, but if you go to the inside of this particular one, there's an insert that again you pull out, and it lists all of the services in which ANOA supports our older Americans here in Douglas County and across our region. So again, I would encourage all of you to take a look at that, and if you know someone that is in need of assistance, to please contact have them contact our Office on Aging. With that, is there a motion to approve? Motion by Commissioner, I think it was Mike Friend, and seconded by Commissioner Rogers. Any questions or comments? Please vote.
Voting yes.
I vote yes.
Motion passes 7-0. Commissioners Mike Boyle and Morgan voting virtually, all other commissioners voting in person.
Next is citizen comments. Is there anyone in the chamber wishing to speak to the Board of Commissioners about an item not on the agenda?
Thank you. Larry Store, 5015 Lafayette Avenue, Omaha 68132. I won't try to read these two articles, but I do want to make a reference to them. In terms of government, particularly city and county areas, when we have a chance to address petitioner government. The first one is article from American Thinker magazine, May 3rd, 2021. It has to do with the hot topic of systemic racism and revolution. I encourage everybody to read it because it makes us think about the falsities of the agenda in regards to systemic racism. The thought that I'm still guilty for racism of the past. But this points out that it wasn't just me. The article also points out that it does involve one of our past presidents who's still active in the background. And these are not my words. These are people that are probably more knowledgeable about things than I am. It's AmericanThinker.com, articles May 3rd. I don't have the author's name on that printout, but it is it's available. Under the topic of Barack Obama, race and revolution. I've brought up that term before, and I think Mr. Boyle cautioned me one day that we will not hear that term in this chamber. But it is in the background, and it's getting even closer to us than we think. So please regard that article. Americans need to think about it and speak out about it. Well, I misplaced the other article, so I won't even mention it though. That's the primary one. Thank you.
Thank you. Any other comments from citizens regarding anything not on the agenda? Seeing or hearing none, we'll move to presentations. Our first presentation is a COVID-19 update and COVID-19 vaccination plan update presented by Dr. Adi Poor. Good morning, Doctor.
Good morning, board members.
Morning.
Thank you for allowing me to give you a quick update. We are today at a 7-day rolling average of 14.3 new cases per 100,000. I just want to tell you that compares to 15 nationwide, and statewide in Nebraska, I just heard a few minutes ago, we are at 10.7. So Douglas County is higher in the number of cases than what we are seeing in the rest of the county. When you are in the rest of the state, when you are looking at cases, we are case number over 7-day average is 81 cases per 100,000. When we look at 60% of our Douglas County residents have been tested for COVID, 12% of our residents have been positive, which means up to now during this pandemic, 1 in 8 has tested positive for COVID. What is really good news is that when we look at the cases last week, we had 572 cases. That's a 21% decrease from the week before. When we are also looking at tests, we also have seen a decrease in testing, but that decrease is only 5.6%. Our positivity rate is decreasing very nicely, I would say, and it is now at 5.3%, test over test. And remember, we want that to be at 5% or below. So we are at 5.3, we are getting there. When we are looking at hospitalization, last night we have 94 COVID patients in our area hospitals. That compares to 83 last week when I talked to you last. So we are seeing a slight increase. However, what is nice is only 8 of those individuals are on ventilators, whereby last week when I reported to you last time, it was 16. So for 9 days now, we have had cases below 100. And I remind you again, that compares to November, where we had 445 individuals with COVID in our hospitals. The low in ventilators is actually as low as we were a year ago in April. When we are looking at our death, every death is tragic, but what we are seeing is we have had 700 in death up to now in our community, COVID related or due to COVID, with a case fatality of 0.99%. Our cases in regards to death have significantly decreased. And I would expect we may get 1 or 2 more death certificates coming in from individuals that died in April. But other than that, April with 11 deaths, we had 14 deaths last April, and that was the lowest we had been. So nice to see that we are there. In March, for comparison, we had 15 deaths, February 34, and January 73. So since January, we reduced every month. What is concerning to me, and I think I shared it with the board last time, is the younger individuals that we are seeing dying, and that means in their 40s and 50s. We didn't see that before. So let me talk a little bit about vaccine, and really a big milestone that we just passed is we have provided more than 500,000 doses in Douglas County. that's doses, to 482,000 Douglas County residents. So that means, there are people in there that we are administer vaccine that are not Douglas County resident. And as a matter of fact, it doesn't matter anymore. We now do not have the requirement that we only give doses to Douglas County residents. Anybody can get a dose administered now in Douglas County if they are 16 years or above. So when we are looking at it, 248,334 have received one dose. That's 58.1% of our community. That compares to 56.7% across Nebraska, and it compares to the nation of also 56.5%. When you look at the fully vaccinated, we now have 46% of our population in Douglas County that is fully vaccinated, 46%. And now I think the next milestone is going to be when we are reaching 50%. And I assume, or I guess that actually may be next time, hopefully when I talk to you. When we are looking at race and ethnicity, we still see that 55% of our white Caucasian population has been vaccinated, and the lowest one are our African American friends at 35.5%. When we are looking at our ages, as you can imagine, the lower the ages, the lower the vaccination. And this is now for just talking about one dose. But it is nice to see that we are seeing a significant increase in our younger population, 16 to 19. And they actually are at 38.5%. And when I last reported to you, they were at 33.1. So a 5.7% increase in that population within a week. And that is the highest increase we have seen. So I'm very pleased with that. And at this time, when we are looking at those that are 65 years and above, 93% have received one shot and 85% have received two shots. When I compare, however, what we are seeing in regards to those fully vaccinated or just vaccinated with one dose, as you can imagine, the highest percent increase we see in those who are fully vaccinated, and that's a 5.8% increase. So what that tells me is those who have received the first shot, last week we have given mostly second shots, not so much newcomers with the first vaccine. And that is really, I think, the challenge that we are in right now. Let me tell you a little bit, for the first time this year, we are not ordering vaccine from the state. And just 5 minutes ago, I heard from the state too, that the state is also not putting in an order. The state as a whole has 250,000 doses of vaccine in the state. And it takes 24 hours for the state to order more vaccine. So again, everybody is going to be conscientious that they are ordering the amount that they think they can use. And that's what we are doing. And that's what the discussion was yesterday with our healthcare providers and our healthcare systems who are leading our community vaccination clinics. I think we all are excited to see when the Pfizer EUA for the younger age group 12 to 15 is going to come out, and potentially that is going to be next week. We are already gearing up with the children and 2 of the pediatric clinics to try to see how can they provide vaccine. What we are hearing right now, I told you last time that we are having discussion with the hospital systems, and CHI is really the first hospital systems where 2 clinics have used vaccines on site. And the others now, Nebraska Medicine and Methodist, they are getting in contact with them, trying to learn. So the learning is, how do we not waste any vaccine? We know now that we are in a phase where potentially there may be some vaccine left over at the end of the day, but everybody still wants to do really the best they can for that not to happen. But with cold storage, Pfizer vaccine, you have 6 hours when you open the vial. There are 6 doses in a vial, and how is that being used best? Actually, unfortunately, Moderna decided to go the other route. They have a 10 vial dose, and now within about 3 weeks, they are moving to a 14 dose vial, which is even going to be more challenging for healthcare providers. But what we are hearing, that individuals who are hesitant of getting a vaccine, they would be most likely willing to be vaccinated at their healthcare provider, because that's where they can get their answers to their questions, and that's where they have the greatest trust. So it is really important for our healthcare providers now to say, how can I do that? I am the trusted source. I want to play a role that my patients are vaccinated. I always tell individuals, especially families now who are wondering if their children should be vaccinated, that probably the most trusted source for the family is the pediatrician who has seen the children since they were young. Why not call up that pediatrician and ask for their advice, what they would advise? So I really think we need to think different now. We are going away from the huge mass vaccination clinics. We don't have 4,000 individuals anymore that we are vaccinating, or 5,000 that we vaccinated at Creighton University. As a matter of fact, May 8th, which is this Saturday, it's our last clinic at Creighton. That clinic was functioning a lot with healthcare graduate students who served in that clinic, and most of them have now finished their classes. They're going into summer break and so on. So that clinic is going to close. All the other clinics, the community clinics, are still going on. But we are moving into smaller clinics, and we are moving into mobile clinics, because now it is, we need to celebrate every dose and every person that we get vaccinated. So last night we had again 2 vaccination clinics, one at Creighton Prep, and the other one I think was at Central High. Both of these were specially geared towards the younger ones, 16 to 19, but parents could also get vaccinated at the same time. We had around 100, 130 at each of the clinic, which sounds like small to us because we were used to thousands, but overall, that's where we need to be now and say, that was a good night. That was a good clinic that we had. Those clinics are from 4 to 8 p.m. And we are having Tuesday Northwest tonight at Northwest High School, and we have one on Thursday at Bryan High School. Again, I think why vaccination is so important for me is what we are seeing with the variants in Douglas County. We are seeing variants, and we are seeing increase in variants. And I just heard a talk from one of the infectious disease doc at Nebraska Medicine, who looked at the Canadian data. And what Canada found is that all of their new cases are now variants, and they have actually seen an increase in cases. We don't want that to happen in our community. The more we can get people vaccinated, the more the variants have a time to reevaluate or reorganize and actually form more variants, that potentially in the end there will be a variant who will not be affected by the vaccines we have on board at this time. So I just want to encourage everybody to get vaccinated as soon as possible so we can get back to normal. That's our ticket back to normal. So that's kind of my report. 46% of our community fully vaccinated. That's a number I'm carrying around in my pocket today.
Thank you, Dr. Poor. Commissioner Maureen Boyle?
Once again, I want to commend you on your efforts to help get us all vaccinated. I really appreciate it. And just a few questions. One is, do you have an idea how many hospitalized patients have been vaccinated already?
No, Dr. Boyle, I don't. And actually, that question, we just asked the question from the state because it potentially needs to come from the state, and they don't have the vaccination and they don't have the ages, because those are two things that are really important for all of us to know. Are we seeing much younger individuals, and are those vaccinated? Now, I can tell you from those where we are getting the death certificates, none of them are vaccinated.
Okay.
So what we have in our control, we can check, and that's what we can check at this time.
I see, and that makes sense. That just, I think, proves that vaccination does decrease the severity of disease, even if you would be hospitalized. So that's the point that I think we all really need to take home with us, too. The second part is just, do you have any specifics on since the Black community seems to be the least vaccinated here, do you have any specifics on what is it vaccine hesitancy, or is it access? And then are we having, you mentioned going smaller in order to reach out. Can you allude to specific ways we're going to hopefully concentrate on that?
Yes. So in regards to our African American friends, it probably is a combination of both, but I think we have to take down all the barriers. And we had a North Star clinic at North Star on this weekend, actually on Sunday. And I was disappointed because we had African American physicians there who went there several days before, to encourage families who pick up their children at North Star to come back to get their questions answered. Those physicians were at the cars, standing at the cars through the windows, talking to families, trying to encourage them to bring their youngsters back to get vaccinated. We only had, unfortunately, 76 individuals who got vaccinated. So I think it is a combination. It's education, definitely, that needs to go along. We are trying also to do now potentially all next week is going to be with the North Omaha churches. We also have encouraged really pastors to get letters out to their delegation and to their citizens, to try to encourage them. If they have questions, ask the questions. Otherwise, please get vaccinated, and these are the sites. And the next thing is going also to barbershops and beauty shops in that area.
Yes, great. That's it. Thank you.
Thank you. Commissioner Kavanaugh?
Thank you. Doctor, just real quick, what's the total number of deaths in Douglas County so far?
The total number of deaths is 700.
And the total number of cases?
The total number, let me see. It's 70,673. That's as of yesterday.
Okay. And if I understand you correctly, we have 46% of the population vaccinated. How does that break down in first and second shots again?
Those will be the ones who either received Johnson & Johnson or received 2 doses. So that means fully vaccinated. And those who only have received a single dose is 248,334, or 58.1%.
Okay. So I'm seeing in the national press anyhow, vaccination percentage for Douglas County of 35%, but we're actually above that reported percentage in Douglas County. Is that correct?
Yes, we are, Commissioner.
And in terms of the total number of tests in Douglas County, what can you tell us on that number?
The total number of people that we have tested is 344,168. That's people tested.
Right.
60% of Douglas County residents.
So the number of people who have had COVID and recovered, what is that number again? That have recovered? It's on the dashboard. I just don't have it.
The recovered, I didn't put it up. It will be on our dashboard,
I got it.
Commissioner.
We'll look it up. So kind of the point is, Dr. Fauci came out yesterday and said that we may not be able to achieve herd immunity at 70+%, because some people just aren't getting vaccinated. And so we might have to go another route to get that. Based on what I'm seeing here, and tell me if this is accurate or not, we have the total number of people vaccinated plus the total number of people who have recovered from COVID and presumably would have some form of immunity that way. Added together would give us a larger number and a percentage of our population. Do we follow it that way? Does that make sense in terms of our local progress towards herd immunity?
No, we don't. It does make sense, but you know, in the beginning, everybody always said, even if you had COVID, potentially your immunity is only there for 90 days. They have changed that now. It potentially could be longer than that. And therefore, you should get the vaccine. So we don't have a breakdown of individuals who were COVID positive and then got vaccinated. And I would think it's probably a pretty significant amount.
Okay, so as far as we can say, in terms of hard immunity at this point, that would be the 58% of the people who have either been Johnson & Johnson vaccinated or vaccinated twice with one of the other variants. Is that right?
No, that's 46%.
46%.
We are at
I'm sorry.
46%.
46%.
Sorry, one
Okay.
minute.
Sorry?
Your 1 minute notice.
So based on what you're telling us about the outreach to the younger people, that's very encouraging. And I know that you were at, I believe, North High School last weekend, and that's great. The thing that I was really struck by in your comments was, and correct me if I'm wrong, none of the death certificates that we've received relative to cause of death was COVID were people who had received vaccinations. Is that right?
That's correct. That's correct.
So nobody,
and that goes back.
nobody who's died, of these 700 people who have died, have been vaccinated, right?
That's correct. Yep.
Well, that would tell me that if you're vaccinated, you've got a pretty good chance of not dying from COVID. Is that right?
Thank you, Commissioner Kavanaugh. Any other questions or comments? If not, Commissioner Kavanaugh, you can continue.
It would tell me that if you've got the vaccination, you've got a pretty good chance of not dying from COVID. Is that correct?
That is correct.
Okay. Thank you very much.
Thank you.
Any other questions or comments for Dr. Poore? Commissioner Mike Boyle?
Yes, Dr. Poore, I think you've done an amazing job. You and your staff have absolutely blanketed the city several times, the county, the area, trying to tell people how important it is to get vaccinated. You've done an incredible job with the testing, and I just can't say anything bad about what you've done. It's been outstanding. It's been absolutely thorough and complete. And I think the interesting point is really one that I heard Dr. Boyle say, and also Commissioner Kavanaugh, is that people who get vaccinated don't die from COVID. So it'd be really interesting to try to prop that up a little bit, to tell people that. But anyway, I just commend you on the efforts, and we stand ready to continue. I know I speak for the board. I don't usually say this, but I know that we stand ready to continue to support you in every effort. Congratulations and thanks a lot. Keep it up. You're just doing a terrific, terrific job. Thank you.
Thank you, Commissioner Boyle. Thank you again, Dr. Poor. Echo what Commissioner Boyle said. Keep up the good work, and we'll talk to you next week.
Thank you all.
Next presentation is a familiar faces presentation, and presenting is Vicki Maka from our Region 6 office, Mike Phillips from our Community Mental Health Center, and Justine Wall from our Douglas County Department of Corrections. And this is a labor of love, this program, and again, because it is Mental Health Month, it's, to me, mental health should be talked about every day, but we're emphasizing it during the month of May, and this is a program that I thought you all would be interested in having an update on. So, Vicki?
Go ahead.
Good morning, Commissioners. My name is Vicki Maka, and I am the Director of Criminal Justice and Behavioral Health at Region 6 Behavioral Health Care. I'd like to introduce Mike Phillips and Justine Wall, who will also be presenting. We'd like to talk to you about our Familiar Faces pilot program. You're going to have to help me.
Just see some arrows down there if you can see them, or you can just click on the slide as well.
Oh, okay. Okay.
If you need to go back, just there's an arrow right there.
Okay, thank you. Before we talk about the Familiar Faces program, though, I'd like to give you an overview of the Stepping Up initiative, which is where the Familiar Faces pilot in Douglas County originated. So the Stepping Up initiative is a national initiative that's designed to decrease the number of individuals who have a serious mental illness that are booked into jail. And the Stepping Up initiative is very focused. There are 4 very clear goals. The first one is to reduce the number of people with a serious mental illness who are booked into jail. We want to shorten the average length of stay for individuals who have a serious mental illness. We want to increase their connection to care before they leave jail, and we want to lower rates of recidivism. In Douglas County, we have an amazing Stepping Up team that meets every month. We have representatives from corrections, including the jail, community corrections, and mental health diversion, the Douglas County Sheriff's Office, the Omaha Police Department, the Public Defender and County Attorney offices, the Community Mental Health Center, Probation, Lutheran Family Services, who has the mobile crisis response piece, Douglas County administrators, and Region 6 Behavioral Health Care. The team meets every month, and we look at our strategies and data to see how we're doing with our targeted benchmarks for these 4 goals. So nationally, what we know about this population of individuals is that their length of stay in jail is much longer, and they return to jail more often than individuals without a mental illness. They are 3 times as likely to have a co-occurring substance use disorder and a mental health disorder. They're twice as likely to have been homeless in the last year. They're 4 times as likely to have histories of past physical or sexual abuse. They're 4 times as likely to be charged with breaking the rules of jail, 3 times more likely to be injured in a fight at jail, and 38% more likely to have community supervision revoked.
Good morning, Justine Wall, Douglas County Department of Corrections. How do you work this? Thank you. The next slide describes the criteria that must be met in order for individuals to participate in the Familiar Faces project. The first criteria is they have to have been arrested 4 or more times in the Douglas County Jail in the last 12 months. The second criteria is that they have to have a documented serious mental illness, and that's either documented by self-report or through a diagnosis given by the mental health department in the jail. The third criteria is a willingness to participate in the project. This is done by our community mental health staff, engaging with them while they're in the jail in order to secure voluntary enrollment into the program. The fourth criteria is intent to live in Douglas County post-relief so that our emergency community specialists can have contact with them in the community. This next data is a little bit inaccurate on there. We are in the process of trying to automate our reports. So each month I receive a report of individuals that have been incarcerated in our jail within the last month, people with mental health illness. That report contains over 900 names, and that's in people who have been in the jail and also have been booked in within the jail within the previous month. I then take those names and narrow it down to people with serious mental illnesses, and that number ranges from 200 and 250 each month, depending on the amount of people that were booked in the jail and our population during that month. And the last time I looked at those numbers, we had about 150 individuals who would have qualified for this program. I am in the process of trying to get these reports automated from our .com staff in order to, one, expedite the process of identifying those individuals, and also so we can start doing a little bit more in-depth research to provide the number of individuals in the jail, as well as to research the benefits that this program is doing as well.
Mike Phillips, Douglas County Community Mental Health Center. So with stepping up and the initiative, and we're an innovator county, and really trying to figure out, okay, how can we really start showing and making some action? We have our big goals, but the feet on the pavement kind of thing. And so we really decided with Justine being able to identify some individuals to work with, well, we'll do a pilot. And so we picked 8 individuals to start our Familiar Faces pilot with. And so individuals that were identified, they're connected to our emergency community support case managers that we currently have that service. And they are housed at the Criminal Justice Center right next to the jail. And when we started this, it was pre-COVID, so they went over and sat, visited face-to-face, engaged with some of the people we identified, let them know what we could do, make that connection with them. And it's completely voluntary. They didn't have to do it. There's no, you can get out of jail early or this or that. It's just that we can help you break the cycle. And so I think that's one of the significant pieces to this service, is that we really make that connection. We're a familiar face. When we first started this, it's like, okay, we call some of the individuals we see multiple times over and over a familiar face. But really the goal is how we look at it, and we became a familiar face to those individuals. They know us. And so I think that important thing is that connection prior to release. And it's voluntary, it's offering them some hope. So what they do is once they agree to it, our worker will sit with them, help to identify some of their strengths, and start building a transition plan or a release plan or what they need when they're released. And so that kind of really connects and moves forward with it. And so just that service in and of itself is very helpful. But then there's what's extra and added to it is that each familiar face participant is staffed by the planning team that meets every 2 weeks to see what's going on, what's being met, are there some barriers, are there some things or creative ways we can engage or provide service to the folks. And yeah, I mean, it's really, when we talk about collaboration, that's a real significant thing. There is such, and that's why we decided to have all 3 of us up here and talking on different slides, is really to demonstrate this is truly a collaborative effort. And so when we talk about that group that meets every 2 weeks to staff the cases or to really hear what's going on and progress with it, it's our Familiar Faces core team. And so the representatives to that group is the Douglas County Department of Corrections, the Douglas County Community Mental Health Center, Omaha Police Department, Lutheran Family Services, Region 6 Behavioral Health Care, and we have recently added Sienna Francis House has added a member as well. We really saw some benefit to that, even, I mean, as we're moving forward with things.
So the goals of the pilot, the first one was to learn about the factors that drive recidivism at the client level, identify opportunities, excuse me, for system level improvement. We want to decrease the number of jail days, decrease the number of jail incarceration episodes, and increase the number of days between jail incarceration episodes. And this first cohort, as Mike said, was comprised of 8 individuals. We started the Familiar Faces pilot in July of 2019. There were 2 females, 6 males Their charges included misdemeanors and felonies. The majority of these folks had co-occurring disorders, so mental health and substance use disorders, and they had very complicated and multi-system needs, which included mental health, substance use, physical health challenges, housing challenges, employment, lack of support systems, and then just their comfort level in the jail with having been incarcerated so many times.
And so I think one thing's important to point out here, this is really just tracking our data with 8 individuals. So not trying to present this as research. This is just really what you're going to see the next few slides is our data organized in a way that you can maybe try to make some assumptions, but it's not control groups or this or that. This is just reporting on our sheer data. So one of the things to look at is like, okay, are we achieving one of the goals to have individuals stay out of jail? And so we have data that goes to 2018 because Justine was able to really go through and count and do the tick marks because she doesn't have the reports, a lot of energy to that. But what we're showing here is that that helped identify it, and I can tell you that it was lower than it was in 2019 that we have, or 2018 that we have reported, 2017. I mean, it's sort of this progression. You do see a progression of it's going up, 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 up. And that was part of what we looked at as far as, okay, where can we intervene to maybe alter that trajectory? Because I would just assume it would continue to rise. So when we talk about average or total jail days, in 2018, that group of 8 had 801 jail days in 2018. In 2019, there was 1,557 jail days amongst those 8 individuals. And so we intervened in July of 2019, so about halfway through the year. And so then when you look at how many jail days in 2020, you can see 486 amongst that 8. So that's like 1,071 jail days difference just for those 8 individuals. So the next chart talks about number of episodes. That means how many times were they jailed? How many times? And in 2018, of those 8, they were jailed 38 times, 38 separate times. 2019, 49 times. And again, the previous years, it was a little bit lower. You could see sort of there was this progression. It was getting more and more. And then in 2020, there were 25 episodes amongst those 8 individuals. So it seems as though we are achieving some of the things we were looking for. And now we come down to some of the dollar stuff associated with that.
Can you talk a little bit more into the microphone?
Okay, and now we're coming down to some of the dollar costs associated to that. Now this is just jail days. This doesn't count the courts and behavioral health and public defenders and county attorneys and all that. This is just jail days. So in 2018, those 8 individuals utilized $89,712 in jail days. That's what it costs to keep them in jail in 2018. In 2019, those 8 individuals, it totaled up to $174,384. I mean, we're talking some real money now. And then after our intervention and tracking those individuals, in 2020, we spent $54,432 in jail days. Granted, that's still a lot of money, but it's a reduction of $119,000 that the county didn't have to cover. And so now on this one here, it's really getting down into the sort of the individual bits and pieces, real specific stuff. And I don't necessarily know that I want to get into all of this, but this is by each individual showing the percent of total cost of incarceration by year. I enjoy looking at data, but this is almost a little bit deeper than even for me. But I know there's people that really this makes sense, but just so you can see by individual, our 8 individuals, how it's sort of tracked. You see a lot of this similar type of triangle shape for most of them. I think one thing that this points out is that we have one individual who is a very complex individual, and we're still working with him, trying to figure out what we can do to help. But he accounted for 55% of the cost of the jail days in 2020. So that one individual accounted for half of the cost for the jail days. And so here's another representation of the similar, of what we were showing as far as the global the increase and decrease in days, and this is broken down again by individual. So in 2019, it shows that there were, increase in days from 2018, and then go to 2020, you can see it's on that other side of the chart, and that's the number of decrease in days from 2019 to 2020. And then there's the chart below it is also shows the percent of increase or decrease. And so from 2018 to 2019, 2019 showed an increase in episodes for most. For one, there wasn't. It was a decrease. And then in 2020, what the increase and decrease looks, and you can see that there was some significant alterations there, but that breaks it down by individual. And then here's the increase or decrease in jail costs. From 2018 to 2019, most showed an increase in jail costs. There was one individual who there was a decrease in cost from 2018 to 2019. But then in 2020, you can see every individual, there was an actual decrease in costs for jail days. No, it's still me. Yeah. You want to talk about it?
Oh, okay. So some of the things that we've learned from this project thus far is the need for collaboration with community partners. Douglas County can't do this by themselves. So far, we have focused on mainly Douglas County programs and the emergency community support specialists. But due to the complex needs of these individuals, we really need to expand it outside of Douglas County. The second thing we've learned is the need to be flexible with services and funding. We have to meet the needs of the individual. We can't just have a cookie cutter program that fits for everyone. I think one of the reasons why this pilot has been so successful is because we realized early on that it couldn't be just business as usual. We realized that we needed a paradigm shift, and then that the system needed to be more fluid and adapt to the needs of the individual. Based on the data, it was apparent that what we were doing was not working previously prior to the Familiar Faces project, and that we needed to change our thinking. And by changing our thinking, we were able to affect change in our practices, which has benefited the individuals. Like I said, since it has been primarily a county-ran program, we were able to influence those practices and change them based on the needs of the individual. However, in order to meet the needs of the many, which, as I previously stated, we have about 150 that would have met the criteria for this program, we need a larger paradigm shift in the community. The county can't be the only entity willing to adjust their frame of mind in order to serve these individuals. We need community agencies to partner with us. We need both community agencies and funding resources to adjust their policies and procedures to meet the needs of the individuals. There's been more than one occasion during this pilot where an individual that did encounter a setback due to rigid policies and practices and red tape. The community needs to adopt a people-first mentality in order for this program to be a success on the larger scale. So that's where it comes into the flexible programs and services. We also need to engage participants prior to release. That's where the emergency community support specialists have really come into play. I'm able to hopefully provide them with the names of individuals who are currently incarcerated when we're looking for people to add to the pilot, and then they go over to the jail and meet with them prior to release, and hopefully to sign them up for the program in order to start, and also to start planning prior to their release. The continuity with medication is also imperative. And again, the Community Mental Health Center has done a lot to help individuals continue on their meds once they get out. One of the big pieces that we're hoping to continue on is the long-acting injectables. We've been working with our mental health provider in order to get hopefully more individuals on the long-acting injectables who then can continue those shots once they're in the community.
And so my piece of what we know is important is that we talk about recovery. And recovery, has its ups and downs. And when we talk about flexibility, unfortunately, behavioral health systems, medical systems, programs are pretty rigid. You either need the service or you don't, or if you're not achieving, you need to do something different. You need to move on. This is where, just because our individual may disappear from us for a bit, we still hang on to them. We still have them. We still try to engage. And then if they would happen to show back up in jail, we go visit. We go, I mean, they're still part of our service. It's not like one and done. So when we're working with these individuals, it's to know that recovery does have its ups and downs, and we are their familiar face. You know, when we talk about paradigm shift, it's where, okay, if you haven't seen them in 30 days, you have to discharge them, or you have to demonstrate active medical necessity for them to be able to get service. Well, sometimes our people get better, and we're part of the reason, and we continue to do that. Why? When you give them something that they get better with, you take that something away, then you wait for them to get worse just to do it over again. Mm-hmm. And so that's when we speak to paradigm shift. You know, a lot of people talk about recovery, but the systems don't really encourage it. Mm-hmm. It is really looking at that it's a process, and that people, even when they're doing better, still need help. And sometimes what you're giving them is helping them stay better, and you pull that back away from them because they're better, then they get worse. And so when we talk about paradigm shifts, that's some of the things that we're talking about. I think one of the other things that we really did learn is that, yeah, our community and, you know, other providers, we really need to try to figure out and look at what are some alternatives to incarceration. You know, when that's the only choice an OPD officer has for that person who's sitting on somebody's property and is refusing to leave just because they don't know what else to do or to go, and the only choice that the officer has is to book them in jail for trespassing, that's unfortunate. We ought to, and that's part of what we are really looking at is to start fleshing out more alternatives to the incarceration.
So next steps, we want to continue to learn about what's driving recidivism with this population of individuals, both at the client level and at the system, the bigger level. We want to look at what opportunities are there, what are things that we can improve upon. We know coordination and sharing of information are definitely two areas where we need to do better. As Mike said, we want to look at alternatives to incarceration. We need to identify them, expand, and educate people about what they are. And we also want to identify what is needed to expand this pilot, because the need is so great, and yet our resources are pretty limited. We have a team of 2 emergency community support specialists who are meeting with these individuals and then bringing information back to the team that's staffing. And I do want to give kudos to those 2 individuals employed by the Community Mental Health Center. This program would not have near the impact that it has had without their involvement. They're amazing people who are doing very, very difficult work with a challenging group of people. And in conclusion, we want to thank Commissioner Borgeson for being a champion of the Stepping Up initiative, both locally and nationally. And we want to say thank you to all the board members who have supported Stepping Up since the first resolution was passed in 2015. So we're happy to answer any questions that you have.
Okay, thank you very much. Any questions for Commissioner Kavanaugh and then Commissioner Boyle, Mike Boyle?
Thank you for this. And you kind of anticipate where I would go with this in terms of quantifying what we're doing here. So if I understand, this program has been up and running since 2019 with a targeted service audience of 8 individuals, is that correct? Okay. And those individuals come on through an identification process that I think I understand. Are there additional individuals in the program now? Are those 8 individuals still in the program? What's the status of the program today?
I believe of those 8, we have 6 individuals still involved with that, and we have added, I believe, 4 or 6 additional people. So we still very small, because our emergency community support, it is sort of this avenue that we've figured out to help kind of do some of that, but they really do have other full caseloads, and it's typically by standard limited to 3 months of work with them. So we start them out there, but our wonderful staff still maintain them, even though there really isn't any funding, so they have their job that pays, that they have to do, right. And these are sort of add-ons. So we've really been kind of yeah, making it work, but it's not the way that we would like it.
I got you. And so of the 8, you said how many are still?
6?
Yeah, I believe 6 are still active.
Okay. You know, we're dealing with a massive population. I think that the last time that the director was before us, the population was north of 1,200 individuals. And so, you know, we're starting out, and the journey of 1,000 miles begins with, you know, your first 8 people. So I understand that. Do we have plans to ramp this up to a significant number of individuals? It looks like you've identified a population that's hundreds.
I mean, we would love to. And so some of that really comes with the support from the county board on what kind of resources you'd be willing to put to it. But then also, I mean, we would go out to other community, philanthropy and look for some other ways to support that. Okay. But so we've been just kind of going along and doing what we can to be able to show that this would have value. But so to really make it move forward, it will take probably some resources. Now, we can't really go forward with the way that we have it structured right now. Absolutely.
And so maybe you could get us, you know, some type of this would be an ideal next step in terms of dollars of budget. That would be helpful.
I would love to.
Okay. The eyes on the prize, and you go into this very well. I'm with you in terms of getting down to the granular level on statistics, is the average length of stay. It's hugely expensive to the taxpayers of Douglas County to keep 1,200 people in the correction center every day. And so when you get this number of these 8 people down from a significant number of hours to a lesser number of hours, a significant number of dollars to a lesser number of dollars, that's tax relief. I mean, that's really important, in addition to all the good, you know, social services that we're providing to these people in need. So I think that if going forward, we could maybe extrapolate, if we did this program on a tenfold, you know, go from 8 to 80 or something like that, extrapolate those numbers out into the entire population in terms of average length of stay and the cost of those things on an average. I mean, granted, we're just doing a projection, but that's incredibly effective, I think, bang for your buck. What you've shown here is really, really effective. It seems that there are some people who have greater needs than others. So one individual getting $30,000 worth of service is, you know, an outlier, I guess. But each individual in the corrections, if we could put a per capita on it, you know, the cost of keeping them in corrections for one day is a couple $300, I think. And so just that, not having them in for that many days type, that number is kind of a baseline that would be very, very good for us to see. I'm going to run out of time here, but I want to come back and ask you a couple more questions. I really think this is an excellent way to go about this, and if we could ramp it up quicker, I think that would be very, very helpful all the way around to the individuals involved, to the community, and I'll come back with a couple others.
Commissioner Mike Boyle?
Well, Jim, I agree with what you're saying, and I really have to call out Mary Ann Borgeson. I know I mention her once in a while, but this is her project. She brought this back from the Washington, and we talked because both of us are so concerned about mental illness. And we had some meetings with Sienna Francis House and so forth, and tried to get something started. And I'm just, I guess I have to say that this is probably the most important presentation I have ever observed at a county board meeting. This is, first of all, it answers questions. It answers all the questions about funding, housing, problems, everything. And frankly, I think we should take a look at the savings that are being produced and take that money and convert that immediately into this program. I guess it's sort of use the language of the day that I so much disagree with, but defunding corrections. Taking the money from corrections that is being, not necessarily taking it, but looking at it and acknowledging what we're saving and put that into programs that are actually producing results. I find this to be the most incredible presentation. I'm totally knocked out by it, and Michael and all the rest. I don't know what to say. You actually have me, believe it or not, Commissioner Borgeson, they've got me speechless.
That's a first. Thank you, Commissioner Foyle. Commissioner Mike Friend.
Thank you, Madam Chair, and thank you for the presentation. Very good information. Can you folks tell me, or can you give me an understanding? This has been, we've outlined that this pilot began in 2019. I know this is a national initiative. Can you give me an understanding, or are there statistics out there I can talk to Commissioner Borgeson offline too, of where this has been implemented that's past the pilot stage? So places around the country where a county has taken hold of this and they can give us some metrics and understanding of the numbers and success, failure rates, whatever the case might be.
Yep, so what I know, this pilot is one strategy of the larger Stepping Up initiative that we have. So this is a strategy that we've come up with to reduce recidivism. There are other counties who have done similar pilots, but if you've seen one pilot, you've seen one pilot. They're all very, very different, and their outcomes are very different. Some of them are very focused on housing and employment models, where ours isn't. Ours is more of a collaborative and more of a focus on mental health. So they're all very different. So it's hard to compare.
Right, and I'll end it here, but eventually you move past the pilot stage.
Right.
Somebody's actually doing it on a consistent basis. They're working. These have been implemented. You got 1, 2, 3 years of track record associated with it, right, and somebody's tracking those metrics.
Yeah.
I guess all I'm saying is there's got to be there's got to be information out there nationally where, even though there's a dichotomy between the way one county's implemented it and what somebody else is doing from a pilot standpoint, simply put, I want to see numbers. I want to see where this has been successful, right?
Yes, and we do have that.
Yeah.
That was one of the first things we did before we really developed the model, was we researched who's doing what. So
Right.
we do have that information.
Great.
Yep.
We'll look at it. Thank you.
You're welcome.
Thanks for the information.
Commissioner Maureen Boyle.
I also appreciate everything that you're doing. Oh, sorry, I took my mask off. That's not right. So, first of all, it seems very obviously you're trying to treat mental health as a health issue instead of a legal issue. And I think that's what a lot of this really boils down to. Knowing what you're doing also is, or what this whole program, it sounds like on the bigger scale, is addressing social determinants of health. So in addition to doing the mental health piece, but you talked about housing and jobs, and it'd be nice if at some point, once we get this segment really well established, if we could move on to things like that. And I want to go back to Commissioner Kavanaugh's point that this is a cost savings initiative. And I think that's very important. It sounds like we can be spending money up front, but when it's an ounce of prevention is worth a pound of cure here. So I think when we're very careful about spending that taxpayer money, this is one that's actually going to save us at the end of the day. So I think the big question I had was, do you see yourself with this initiative, and let's look like, where do you see this going like 5 years down the road, 10 years down the road, just in a nutshell, not any details, but do you see this as pulling in those other determinants, or do you think we're going to be focused mostly on recidivism specifically?
We have actually talked about the social determinants of health and looking at that. So I think that's something that is a direction we'd like to go. The last year, COVID has slowed us down a little bit, so I think some of our future thinking, has maybe been derailed just a little bit. But I know that the conversations we've had, we really want to expand. We know that this has a positive impact on individuals' lives, that it helps not only get people out of jail, but keep them out of jail. And so we would love to also have more of a focus on physical health. That was, thank you for mentioning that.
Yep, fantastic. The other just part to that was Commissioner Borgeson and I were in a meeting yesterday talking to a woman about how there's a program in Arizona that does a lot of this a very similar thing. And I know it's PNO, but I can't think of the name of it off the top of my head. But it sounds very similar to what we're doing here. So when this woman talked to us yesterday, I was pumped like a little kid about how exciting this all sounded in order to just provide those services for community members who are really need it the most or really suffering. And so that model is something that we could get you information on but it sounds like you're really doing a lot of that already, which is fantastic.
Great.
So thank you for what you're doing.
Commissioner Chris Rogers?
Hey, Justine, let me go back to a point you made, because you were trying to say it diplomatically, but I need to ask you for some examples. When you say a paradigm shift in the community, what shifts do you think needs to take place to match? Or what things haven't happened and need to proceed?
There's been a couple examples where we tried to get individuals set up housing prior to their release, but because their disability is suspended or their Medicaid is suspended, we were unable to secure housing prior to their release. So they had to then in turn go to a shelter for a couple days before their disability would be turned back on, and then they would have the funding for housing. A shelter is besides jail, a shelter is probably the least appropriate place for these individuals to go. And in turn, those individuals disappeared, and then we had to go back out and find them in order to re-engage them back into the program. So that's one example of something that's fallen through. Another example has been the coordination between the courts and corrections and their release date. We've been able to find beds, but the beds were, again, not available until 2 days after their release, their scheduled release date. So again, those individuals had to go to a shelter in the meantime and disappeared again. So our staff had to go out and find them again and re-engage them in the program. So those are just a couple examples of how in my opinion, practices and red tape prevented the individuals from that warm handoff, which is really necessary for these individuals.
So what was the reception when have you all asked about this yet, or have you just implied, or have you asked for some specific progress on it? Where is that stand?
There's been some discussion. We have not made any formal requests yet, or we have not also received any, what's the word I'm looking for? Anyone that came to the table and say, hey, let's try and work together to work this out. It's been us asking about it, us presenting the problem, and a lot of silence, I guess, is the most appropriate word to say. We do have some community providers that have recently joined the task force, so hopefully that will start changing in the future as they really see the mountain and the barriers that we have in front of us. And just go to a previous statement, I think Commissioner Boyle had mentioned, is that we've really focused on the impact this has on the jail and on the individuals and the cost saving for the jail, but we have not really even touched the surface of the cost to the communities individuals are also have in regards to emergency room visits, in regards to short-term stays, hospital stays. So that's one of our next step, is to really also use the region as a resource to start looking at how much these individuals are costing already to the community, and the cost savings possibly to the community that can then be turned into services for these individuals with emergency support specialists.
Thanks.
Thank you. Any other questions or comments, Commissioner Kavanaugh? It's your second time.
Circling back to something that both Mr. Phillips and Ms. Wall brought up, is the lack of long-term health care, mental health care capacity in our community, beds or homes or places for people to go after they're out, is one of the things I hear both of you saying is kind of holding us back a little bit. If we're going to look for a shift in the community, what do we do with these people after they exit the Douglas County Correction Center is one of the things that we need a shift to. Is that correct? Is that fair?
I wouldn't say it's hospital beds, it's shelter beds, it's not hospital beds.
I mean, I can speak for myself.
Yes.
And I think that I think there needs to be a little bit, I mean, we've become so concrete, and okay, if you're not doing a particular level of care, you need to be in another level of care or another level of care, and sometimes it's not so concrete. I think there's some of the sliding that needs to happen between services and levels of care. I think there is some good, solid community programs and services out there, but they end up where you lose people in transitions from one piece to another piece to another piece. So that long-term consistency, whether that be a specific program or a specific place, is something that probably could be looked into. I think we have some pretty solid providers, and we do have a variety of levels of care that are available in our community, but it's when people move or are being forced to move from one provider or program to another. It's during that transition that it's really difficult for some of our people.
Right. So during these recent town halls on mental health that we had, one of the continuing themes that came up from some of the most informed healthcare professionals that presented was that there are basically no long-term mental health care beds in our community. So if you're going to be a long-term care situation, that doesn't exist here. And so we're coming out of a correction system and we're trying to get them the services that they need in the community. I'm not talking about the outpatient that you do an excellent job on. Long-term mental health care beds, inpatient beds, residential beds. And I'll give you an example. 30 years ago, we had numerous chemical dependency inpatient treatment facilities in Douglas County, usually 30-day programs. I don't think we have any anymore. I don't think any of those exist anymore. What we do have is a detox center that the county runs and funds for people with alcohol or chemical dependency problems on a crisis basis. And then where do you put them? I mean, these people, many of them, cry out for long-term inpatient treatment for their chemical dependency problem, which is the first cousin of what we're talking about in terms of the mental health problems. But if you take the population of the Douglas County Correction Center, you have a significant number of people with chemical dependency issues in that population. Where do we send them when they come out? In the community. Is there a place?
I mean, there's several of the short-term residential programs, that 30-day program, and those are voluntary so people can walk away. They're not, locked up, and it's not what you'd consider inpatient, but more residential. But there are the short-term residential programs, but there's long wait lists for those. And so, I mean, what we would do is we use what we have. I think what you're speaking as far as more of a residential, longer-term programs, those don't exist.
Okay. So like we do with, our elderly population or our disabled population, there are long-term, you've heard earlier today, we talked about a tax case that involved someone who's in an assisted living facility. Those exist, and they are proliferating in our community.
1 minute.
There's nothing equivalent of that for people who are coming out of this very laudable program and are going to present with those same needs. We don't have that, and we got that in the hearings that we just concluded, and I think that that's something that we should maybe address in terms of an adjunct to what you're doing. Expand what you're doing, but then if you're putting these people on this treatment conveyor belt, you just can't drop them off after they are released from confinement. They have to go someplace, and some of them can't be outpatient. They must be long-term inpatient treatment for both mental health conditions and chemical dependency issues. So
I would
thank
just add to that supportive housing, additional supportive. We have a very small capacity for supported housing. That would be another resource that would be greatly needed.
Great. Thanks a lot.
You're welcome. Thank you.
With that, I do have a couple of comments, and Commissioner Mike Boyle and I actually are the ones who started the conversation when Commissioner Boyle was chair of corrections. And I was working with the community mental health stuff. And what we did was we sat down for the very first time and had people who were in each of those departments talk to each other. And it was pretty amazing how there was a lot of overlap of what we found each other could do. We started to do our sequential intercept mapping on our own, and it got to the point where it was just too much for us to be able to keep up with what we needed to do. Vicki, Maka was hired to do the Stepping Up initiative because of that, and she's done a spectacular job. This particular program, I'm just blown away with. I mean, again, we've talked about those individuals who we kept seeing coming in and out of our door, and what could we do different to help these individuals. And we do talk about the cost savings to corrections and to community programs, and but think about the change we are allowing this individual's life to have happen. There was an individual who actually graduated from the program, if you will, or who was helped through this program, that sometime maybe we'll have another individual come and present her story or his story, because that's really what it's all about. If we can save one individual's life from the absolute disaster it is in, to me, that is all worth it. Unfortunately, I still am of the belief that we need to decriminalize mental illness, and individuals should be able to get the help that they need for their mental illness without having to come to jail to get it. But I thank God for you guys being there and coming up with these programs to help these individuals and get them started on the right path. Our listening sessions were amazing. Commissioner Boyle, Maureen Boyle, and I met with a couple people as follow-up yesterday. More good ideas, and we're trying to discuss how we proceed. There's a want for people to continue to talk about this issue and publicly with us, and so we're looking at that. When we talk about where homes, where these people live, again, Commissioner Boyle and I have kind of joked, but we're serious that there really does need to be almost like a tiny homes project for these individuals. And I'm a big fan of the tiny homes project and have been for a long, long time. And I'm happy Santa Francis House is doing one close to their facility, but we need more of such a thing, because it's not only that, but it's affordable housing for these individuals to get back on their feet and be able to be productive citizens. There is just so much need out there. When there is talk about long-term care, that isn't our purview. That was the state's, and I'm going to keep banging on the door of the state, because through reform, the regional centers were the long-term care beds, and they shut them down. We have one regional center that the state can't decide what its purpose is, and it keeps changing. And so we need to, again, listen to what those, I mean, the ideas, the suggestions we got from the public on what is needed for those suffering from mental illness was extraordinary that we got on our listening sessions. And so again, I think we have so many opportunities, and it's at the right time, we're in the right place, we're focusing on it. And this program, again, is one that I could see expanding and putting more resources in to expand it. So I just want to thank you guys. And when I said it was a labor of love, it really is a labor of love. Seriously, it is. And I can't thank you enough for the work you all do, including those that aren't here today. But we'll continue our discussions and continue working with our community partners, and we will change the trajectory of how mental health services are provided. So thank you very much for being here.
Thank you.
Thank you. Wow.
With that, we do have another presentation, the Nebraska Extension in Douglas and Sarpy counties. It's an update and highlight presented by Carrie Miller and Cynthia Zlitke. I'm going to torture it again, but this was put on by Commissioner Maureen Boyle, so did you want to make an introductory? Oh, there you go.
There you go, thanks. Yeah, thanks for coming. This was informational more than anything, as a newer commissioner, community services is under my guise, and so I thought I would invite Extension to come and speak. I've had them talk to me just to be informed about what they do, and I was amazed at the breadth of the things that they do. So with that, I just wanted to give you folks a chance to present on what you do for us.
Sure. Thank you very much. I'm Cindy Zaludicki, and I am the Urban Program Leader for University of Nebraska Extension, as well as Engagement Zone Coordinator. And my territory includes Douglas, Sarpy, and Lancaster counties. Is the mic enough? Okay. We want to thank you for your support of Nebraska Extension and also for approving the interlocal agreement this morning. That will enable us to continue forward with our mission and working with both Douglas and Sarpy counties to achieve that mission. Our mission is to help Nebraskans enhance their lives through research-based education. And Extension has some uniqueness to it in that it is to bring the university to the community, to the people of the community. And so it's a way for the folks in Douglas County, Sarpy County, to access the University of Nebraska without ever stepping foot on campus. We also are a trusted source of unbiased research-based information, and we serve all ages. We have programming from early childhood to senior citizens, and also serve all socioeconomic groups with our programming. Let's see if I can get. So the local piece of this comes through the county and through the county funding of our programs. And this vital piece of funding helps provide the local support to deliver programming in the county. And this is in the form of facilities, program and support staff, operating costs, travel, and supplies. The university is the land grant. I also want to point out that each of the commissioners appoints a member to our extension board. Just a couple weeks ago, I believe PJ Morgan had a member appointed to the extension board. And the university then is the land grant university, the University of Nebraska at Lincoln campus. And so our funding comes from the state legislature through the university and then flows through the university to extension. All of our extension educators are considered faculty at the university. We have 27 university paid employees that work in Douglas County providing programming. The university's funding provides the educational staff, the development of educational programs, technology, and professional development for our staffs as well. And then the federal funding partner is through USDA, and NIFA is the branch of USDA that our funding comes through Smith-Lever funds. And these are formula funds that provide some staffing, excuse me, to the university. We also get funding for research and for some federal grants and contracts as well. And we deliver our programming, our research-based programming, through direct teaching. We also do experiential learning opportunities, particularly through our 4-H program. We do online learning, which really, we did a lot of this last year in COVID. We really strengthened our offerings in that area. Publications, we work with the media. You probably see some of our faculty members on TV. If there's a bug outbreak of some sort, our urban entomologist is usually on there. We also work with partnerships across the county, and we have very large volunteer programs as well. So I'm going to turn it over to Carrie Miller, who is our interim unit leader for Douglas Sarpy, and she's going to tell you more about the specific programming we do here.
All right. Good morning, everyone. Nice to be here. I get to share some of the fun parts of all we do. We do a lot, so today I'm really just going to scratch the surface of everything that we offer. I'm going to share it in 4 different programming areas. The first one is our 4-H Youth Development Program, where we offer enrichment programs in the area of science, technology, engineering, and math. Some of our new exciting programs we're doing right now is a NASA grant with aerospace. We also have a really great robotics program, an embryology program where we have just reached 1,300 OPS 6th graders with that program, where they got to, it's more than just hatching eggs, but that's the fun part, but they get to learn about the development and the science behind that. We, of course, teach about ag literacy. We have our traditional 4-H clubs, which teach the youth about community service, about public speaking, so they can do things like this when they grow up. They work on projects, they can present these at the fair, and we have events all year long. I'd like to and I hope to share this information with you throughout the year too, that you're able to be involved in those ways and interact with our youth throughout the year. We also have a strong youth ambassador program where we're offering experience to youth all across Douglas and Sarpy County for career exploration and different opportunities to learn and grow with our staff. Another program is community environments. An easy way to think about that is plants and bugs. It's more than just growing pretty plants. Our team works on environmental and public health issues. If there's bed bugs, that could have an economic impact on our community, a health impact. Ticks have a health impact. We have an urban entomologist. She helps track which ticks are in this area, and it has a health implication of what diseases might be in the area, and that helps the health providers in our community. We have a horticulture team, and part of that horticulture team is 250 trained master gardeners. In 2019, they contributed 13,000 volunteer hours. They work at community gardens. There's community teaching gardens in Douglas and Sarpy counties. We have a hort helpline where the community can call and answer questions. 11,000 questions were answered in 2009. I think 9,000 last year, even during COVID. So we're still reaching the need even during a pandemic. And we have an urban agriculture educator that helps teach how you can grow produce and feed your family, which took off huge last year, as a lot of us know, and how to preserve that food and how to do it safely. We also have the Grow Big Red virtual learning series. The next series is about pollinator gardens. So I think that's today. So if you want to log in later today, and those are recorded. A third program is the Nutrition and Food Safety Education Program. And so I've worked with Extension since 2001. I'm a registered dietitian. The program that I lead is the Nutrition Education Program, which is grant funded, reaching low-income populations in Douglas and Sarpy counties, teaching them how to eat healthy on a budget, how to be more physically active. A lot of our work too ties into the presentation before. We work with a lot of transitional living facilities and teach them how, after substance abuse, and how to eat normally again, and how to sustain your health, and how to be physical active, and how to spend any resources you may be getting in the terms of SNAP or WIC and resources like that. We also work in the area of policy, system, environment work. So for example, we're trying to make the healthy choice the easy choice. So if that's working with child cares, the Healthy Neighborhood Stores Project was a project we were very heavily involved in for about 12 years with the Douglas County Health Department. We're now calling that the Double Up Food Bucks program, which is a SNAP incentive program that's offered at some stores in Douglas County, and we are really hoping to expand that. That is our goal, and we have a lot of support around that. Also, we have a very strong food safety education program. 4,000 food service managers and employees have been trained over the last 5 years in Douglas and Sarpy counties. So we all like to eat out, at least most people do, so assuring that our food is safe to eat and that we're not getting sick. And the Learning Child is the fourth programming area I was going to talk about today. They provide child care providers continuing education programs to keep their licensure. And in 2020, this program, the child care providers really liked the virtual side of this. There was 900 child care providers. They did a series of classes in 2020 during COVID that they were able to increase their knowledge of how to best care for our children in child care. As a working mom, Our kids are in childcare a lot, and so knowing that our childcare providers are being trained, our extension office is providing a lot of those trainings. And we also, another program that falls within that is the co-parenting for successful kids. So if you have parents that aren't living together, they're co-parenting separately. This is a program that's statewide and also has a large presence here that works with those parents on how best to raise that child together in a positive atmosphere and relationship. So I just want to thank the commissioners and the county for your continued support of all of our services and resources we offer the community. And I look forward to working with you in this role more in the future, inviting you out to more of our programs. I would be happy to set up individual, if you're a certain educator or you want to learn more about insects, Jody's great, or John Fesh, or Cindy Bryson with food safety. I really look for opportunities how we can connect more and educate more about what we do and get your input.
Thank you. Any questions or comments? Commissioner Maureen Boyle and then Commissioner Mike Boyle.
Yeah, I just want to say again, thanks for coming to talk to us. I was looking at the handout, or do you have an easy website just to access everything, first of all? And second of all, I was amazed to learn about all I didn't realize you got into the educators. And so the Learning Child and the things you do, like their Success by Six programs, I think those are critically important. And just to have a resource like that is, like I said, you don't think of Extension as a department that does, an area that does that, but so I appreciate what you're doing, especially in that aspect, but everything else too.
Thank you.
So do you have a website?
Yes,
or,
yes.
Yeah.
Douglas-Sarpy@unl.edu. That's our local website. So Douglas-Sarpy.
All right, thanks.
Yeah, and we have quite a few of our educators have a large presence on Twitter that they're updating, when things are happening. Ticks are really happening right now. So there's a lot of information about that. So
good deal. All right, thanks a lot.
Commissioner Mike Boyle. You're muted, Commissioner. Nope, still muted.
There you go.
There you go.
Thanks. In the last year or so, I've run across some people I met particularly at the H&J Towers in South Omaha at the OHA. And I wanted to ask, they wanted to do some urban gardening. It was really interesting. There was an old man there, elderly man, probably as old as me, and he traveled to North Omaha and he had a private garden out there and brought the fresh fruit and fresh vegetables rather to the OHA Tower in South Omaha. But I wonder is it possible for the Extension Office to, in their urban gardens program, to get together with the OHA and Douglas County Housing Authority, and maybe even some private restaurants, if that's possible, to Sienna Francis House and others, to do gardens so people can, kind of get distracted by the gardening and all the rest of the good things that comes with that. I'd like to ask if that's something you have done or could do. And that's really my primary question today. And also to congratulate you on the success that you have. I have a wonderful, wonderful volunteer serving that I appointed a couple of years ago, and she's absolutely enthusiastic. So I really, I haven't kept in touch with her because I moved, but anyway, thanks for what you do and for the volunteers that work with you. Thank you.
Thank you, Commissioner Boyle. Yes, we do exactly what you're saying. We help establish those gardens, and then we train the residents or somebody to be in charge of that garden. We don't have the capacity to manage that garden every day, but we're always there to answer questions, to help it keep going if there's a pest or if there's something not working. So we help start those gardens, yes. So if you could provide me that contact information, I'll get that to our horticulture staff.
Okay, that sounds great. And then the last thing I wanted to mention was something that I saw in a city. It was really Lady Bird Johnson that did the deal. It's been quite a while ago, but it was in the South. And what it is wildflowers. Quite a few years ago, we tried with the Omaha Public Works Department. We planted a bed of wildflowers in the median that heads from about 130th up to 130th and 2nd and Pacific. And it was of course, in the median, and we planted all these wildflowers, and it was really cool when you came over the hill and saw all these colors. Well, we had to take them out. You know why? People were stopping to pick the flowers, so they're so beautiful. I'd like to suggest that Extension take a look at with the City of Omaha Public Works, maybe doing some beautification on some areas that are safe with wildflowers. It's absolutely no maintenance and really adds a real kick to the city and the county. Thanks.
Great, thank you.
Any other questions? I am interested in the tick information. It was interesting. I had a cousin who posted on Facebook that she was just out in her backyard and came in and had a tick. The dog had a tick just from being out in the backyard.
It's an urban issue as well. It's not
Yeah,
just rural.
right, exactly. And just, and I keep hearing everybody say it's going to be a really bad year for ticks. And of course, that gives you the, one of these
It's because it was warmer
things,
earlier.
What's that?
Because it was warmer earlier. That's what I was just told yesterday.
Oh, okay, because I was just going to ask, what is the reason for that? But that's the reason,
That's
huh?
my simplified.
That's
I'm
it.
not the entomologist.
Right. But I do also agree with Commissioner Boyle, anytime that we can find areas in which we could partner, regardless of who it is, to beautify the areas around our community, that's well worth the conversation.
Yeah.
So, but thank you for being here, and thank you, Commissioner Boyle, for bringing it on. I think that it might be worth some of those programs, especially like the urban garden, if there's a map that we could produce as to where those are, and then information on how you actually get one started.
Mm-hmm.
And that would be interesting to me. But then any of the other programs that, we could maybe do like we did with the previous presenters, is really drill down onto those programs. I think people would be very interested. And of course, 4-H, I would be interested. I used to be a 4-H leader way back in the day, and I'm glad to see that program still flourishes.
Yeah,
So,
it is.
okay. Thank you, Commissioner Kavanaugh.
Thanks for this. This is great. You do good work. I'm particularly interested, I didn't know that you'd gone into this, with the 4-H's expansion into the STEM school enrichment area. That's hugely important and very relevant. Have you gone into collaboration with some of the STEM schools in our community and OPS and other areas?
Yeah, we have a very large presence within OPS and all the school districts actually in Douglas and Sarpy counties. And our 4-H team we use this map line program where we've really mapped where we're at, and I didn't share that today, but we could always drill down more into that, of where our reach is specifically by zip code and county, and then we're using that information to see where we're maybe not. So yes, we're a very strong collaborator with the science-based STEM programs in the OPS schools.
That's really great, because as a largely urban county, I think it gives relevancy to 4-H, which has been traditionally seen as kind of a rural program for rural kids.
Yep.
But we have robust STEM schools in our urban areas of Douglas County, and having 4-H in there is a real step forward. So thanks for doing that.
Thank you.
All right, thank you, and thank you, Commissioner Maureen Boyle, for putting this on. Thank you. We'll move to our finance. First is our budget report as presented, unless anyone has any questions or comments on that. Otherwise, we will move to the two finance presentations that we do have. We have the first one being the presentation by the clerk's office on the department's fiscal 21-22 budget. They are in $28,420 in excess of their budget target amount. And so, Dan, did you want to start the presentation, and then we'll go ahead and have questions if Joe wants to add anything?
Okay, thank you.
Thank you.
Good morning, Dan Esch, Douglas County Clerk. So I think I was going to handle the day was kind of a lot like County Attorney Klein and Mr. Schoenlaw did last week, was maybe just start off by telling the public a little bit about what it is we do, and then get into the numbers. So the handout I'm sharing right now, it's on the front page. So just kind of covers the responsibilities and services we provide. So we're the official record keeper for the county board. We have board records going back to what we believe is the first board meeting in 1857. Obviously, the county was established in 1854, but we do not have a record of a meeting prior to 1857. So The county clerk is also the ex officio county comptroller for Douglas County, so the office is the general accountant and fiscal agent of the county, and we present. When you do the minutes and claims, that's basically we're making payments for all the bills and invoices that have been submitted to Douglas County. Then we keep a record of those payments. So in addition to those, we also issue marriage licenses. We issue about 3,900 marriage licenses a year. Some years it's literally close to 60% of the marriage licenses in the entire state. We issue locksmith licenses, but actually not for much longer. LB 169 eliminates our role in that process. So effective, it's like 90 days once the session ends. So sometime late August, early September, we will no longer be issuing locksmith licenses. Basically, if you're a locksmith, I think there's a couple different things you have to go to, but one part of the process is getting a license from our office, registering with us and getting a license. And so like I said, we're still doing that right now, but only for a few more months. We issue, and that's countywide. Liquor and tobacco licenses, we issue those, but only to those establishments located outside of the county's cities and villages. So we only issue, right now, in 2021, we've issued 12 tobacco licenses and 38 liquor licenses. And, all these establishments, or whether it be a restaurant or a gas station, they're all way west or way north. So if it's inside the city limits or village limits of, Omaha would do it, city clerk would do that. Ralston, their city clerk, Waterloo would handle those inside Waterloo, and so forth. Every June, which is just around the corner, and I'm sure we'll be talking about this pretty soon, Douglas County accepts property valuation protest, and the Board of Equalization is kind of a collaborative effort between my office and the Commissioner's office. So Catherine Hall serves as the BOE coordinator, and I guess to put it succinctly, kind of the referees report to her, and then the clerical staff, which is kind of like the people who help the people who call in, the protesters who call in with questions, whether it be what should I submit or how do I submit it. And then as far as the record keeping, that's where the clerk's office comes in. Catherine doesn't make any decisions. I or the clerk's office doesn't make any decisions, but we're just involved in the process, and the clerk's office just needs to make sure that people get the help they need as far as questions being answered, and making sure everything's properly filed and processed. We record military discharge documents. That's not a requirement if you're a veteran, but a lot of veterans do like to file their DD-214s with us, and that's a free service. We process payroll for all Douglas County employees. As of the last payday, which was last Friday, we have 2,428 employees in Douglas County. A little over 2,000 are full-time, and then the remaining 400 some, or high 300 some, would be part-time and seasonal or employees. So the county uses Oracle for our enterprise resource planning software, which is just the system the majority of the county uses to run its programs and functions. And we have an Oracle functional lead in our office who provides functional support to all county departments. So this person would work very closely with .com, but this is just kind of a resource specifically for Douglas County, whereas opposed to a .com resource could be enterprise-wide. We frequently post information to our website, and I'll get into that's douglascountyclerk.org. And of course, if you're looking at the screen, I do have them listed just below my bullet points there. And our social media accounts try to keep the public up to date on issues and topics of interest related to Douglas County. So we, Leah posts a lot, so we just kind of retweet and repost what Leah, the county's PIO, does. And then, of course, with the elections coming up, we will, if the election commissioner shares something, we'll do that. I guess an example, other than that, another example would be on our, if you went to douglascountyclerk.org, we just have towards the top a link to the assistance opportunities that are available for rent and utility. So some of the stuff that we share and post, we're not the ones that really oversee it, but we just want to help, spread the word on some of these important things that are going on. And finally, it's not really a statutory requirement, but we're kind of like a customer service point for Douglas County. A lot of people just don't know where to go, so they start with us, and we just want to make sure that our goal is to make sure that when we transfer you, it's the last time you get transferred, that we got you to where it is you need to go. So there's our website, douglascountyclerk.org. We're on Facebook and Twitter as well. So if you just went to facebook.com/Douglas County Clerk, or if you searched at Douglas County Clerk, or if you went to twitter.com/Douglas Co, so Co is in short for county, Douglas Co Clerk, or at Douglas Co Clerk. And then if you want to contact us, like the main office email is countyclerk@douglascounty-ne.gov. So if you're on our website, went to our contact us page, that email address would be there, and that goes to 4 people in the office that receive that. Then we just, from there, we figure out who it needs to go to. My personal email address, daniel.esch@douglascounty-ne.gov. Phone number, 444-6767. That's our main line. And then where we're located, so we're in the Civic Center here at 1819 Farnham Street, and we're on the Harney level. So there's a couple ways to get to us, but the closest entrance that we're to the building is off of Harney Street in between 18th and 19th Street. So if you went through the Harney Street entrance, we'd be the first office on the right. And our office hours are 7:30 a.m. to 4:30 p.m. Monday through Friday. I had a question prior to the meeting about when do you, so currently we're not open to walk-in traffic. Someone asked, well, when do you think you will be? And we're actually under construction right now, and I don't think we'll actually, the office itself, now we may work something else out, okay? But as far as the office, it's looking like we won't be open until July. Now a question might be, well, you've had all this time, why are you just doing it now? Well, the answer is, we weren't exactly on the top priority list for public properties in Douglas, and the building commission. When you think about corrections, the health center, the courts, those were kind of things that we were kind of put on the back burner, and understandably so. Unfortunately, we just didn't really get around. They just weren't able to get around to us until about a week ago, and we were just told that their most honest estimate for us was July. So I would love it if we could be able to open up sooner, but that's the situation right now. So as far as marriage licenses, people are mailing their applications in. There's other ways we help them. Certainly if there's an emergency, this has been the case ever since last October. If there's some sort of emergency situation, we will certainly take people in and help them out. This is obviously, when it comes to a marriage record or a marriage ceremony or your DD 214, these are pretty important things, and we do our best to help people as fast as we can if there's, if it can't be something that can wait a couple days, And then at the bottom is why I'm here. So our budget target was $1,795,847, and our budget request is $1,824,267. So we're about, as Commissioner Borgeson stated when we began, $28,420 over the target. Before I go into kind of the details on that, I'll just go over our organizational chart. So of course, like I like to remind every person when it comes to voting, you're at the top of the organizational chart, not me or any elected official. So anyway, citizens of Douglas County, I should maybe, citizens and residents of Douglas County at the top, Douglas County Clerk Comptroller, Chief Deputy, and then we have, here are divisions below. The 0.5, that just indicates a part-time person. So when you include me, the Chief Deputy, and the staff, that's a total of 22.5 people. And just to give you some idea, when I first began the clerk's office in November of 2006, we had over 30 people in the office. So this is a comparison to last year. So really what makes up, well, I'll go through this chart, then I'll explain why the personnel is so much higher. So our personnel subtotal for our budget this year is $1,680,046. The non-personnel is $187,056, but that does include $96,456 in CARES Act funding, which I appreciate very much, this board allowing us to receive. Mainly we used it to, well, not mainly, what we used it for was software to help us be able to establish a work from home environment and improve some processes that just help us work remotely better. And then a big part is what's going on right now, the construction, our lobby area. It's going to make it a lot more spaced out, and just, we'll be better if, heaven forbid, this another pandemic happens. We'll be able to handle it. Well, I mean, I guess it obviously depends what the pandemic is, right? But let's just say it's a similar situation what we're going through right now. The spacing, the plexiglass, the distance that we provide for the customers and our staff, we'd be in a pretty good spot going forward. So once it's open, I'll invite you all down and take a look. So I think it's going to look pretty good, and I think it'll be better served, not just our staff, but also the applicants that come in. So below is what the top part shows what it would be, what our budget is. Our budget right now is $1,867,102, but if you took out the CARES money, then our total would be $1,770,646. So requested budget for this year, the personnel subtotal is $1,757,447. That's an increase of $77,401. So a big part of that is I've got 10 of the 22 and a half staff are scheduled to see increases of 5% or above. So I've got 2 employees that over the next fiscal year, their salary will increase between 5 and 6%. 5 employees who will see an increase between 7 and 8%, and then 3 employees who will see an increase between 9 and 11%. And that's all due to either the union contract that they're in or to the civil service step plan that was approved. I think it was towards the end of 2018, I believe, that covered the years 2019 through 2021. So to I want to be a good teammate. Joe and I in our office, we work together a lot, and Joe's a good partner, and trying to be a good partner to him too, but I just can't quite get it down to the target. So what I'm requesting is, I'm requesting the personnel budget of $1,757,447, but I'd just like to point out that my non-personnel request is $66,820, which the directive was to remain flat in your non-personnel. And the decrease from $90,600 to $66,820, that's a 26.2% reduction in non-personnel cost. And so I wouldn't be very comfortable going much lower than that, just be honest with you, and that's why I'm here. I wouldn't be here if I didn't think I've had to be. So to reiterate, the target was $1,795,847, and the clerk's office is requesting $824,267, which is $28,420 over target. The last sheet I'll go over before I open up the questions, just a history going back to fiscal year 2017. I'm just trying to illustrate that we don't ask for money if we don't need it. We don't spend money if we don't need to use it. Last year we were $85,411.89 below the target that was given to us. So I could have requested $1.84 million, and I didn't, because my team and I thought that 1.755 million was a realistic number. And I just kind of show those rows in yellow, if you can see them. Basically, if you combine even this year, including the 28,000 we're requesting over target, if you go back the last 6 budget years, we've requested $166,809.55 under target. And then our year-end remaining balances, like when the year's all over, everything's been spent. So obviously, the reason why, if someone's looking at this and wondering why, well, how come fiscal year 2020/21 is incomplete? Well, that it's not done yet. We're still going on. So I can't give you what I've actually spent or what's the year-end remaining balance is. But anyway, when you add up the 4 years from fiscal year 2017 to 2020, we've given back $64,073.88. So I'm just trying to highlight that, the clerk's office could have asked for and or spent $230,883 the last 6 years that we have not, because we're a very small part of the county budget. The general fund this year is $322.5 million, and we're less than $2 million, so obviously we're a very small portion of that, but obviously everything adds up, and so we just do our best to do less with more, or do more. Do more with less. I could see Mike laughing. Do more with less. Let me please clarify the record there. Do more with less. Anyway. And just last 2 historical things that I will point out before I turn it over. I know I can go back to fiscal year 2016-17, but the employee count, like I said, I don't have an exact number as far as what it was with if you include seasonal employees or part-time employees, but I know the clerk's office, as late as 2010, had 30 full-time employees on the staff. So we've, over the last 10 to 12 years, we've cut the staff size by 25%. And in fiscal year 2011, our budget amount was $1,786,282. And this year, if you took out the CARES funding, the clerk's budget is $1,770,646. So we've been around flat for about 10 years now. And I'll keep trying, don't get me wrong, even if the board is amenable to my request. I just hope I've proven to you that doesn't mean we're just going to spend all of it. We'll do our best to see where else we can come up with some cost savings, and I think we've demonstrated a history of that. So anyway, appreciate you letting me talk, and I'll take any questions you have.
Any questions for the clerk? Commissioner Kavanaugh?
Thank you. Thanks for this, and thanks for all you're doing. It's great to see efficiencies in government that give us smaller, smarter, and cheaper government. And you lay out a great case here. 25% reduction in staff in 10 years, flat budget in 10 years. I don't know too many other areas of government where we can come and look at that. And, underspending by $250,000 since 2016, kudos on all of that. The philosophy of the clerk's office, which I admire, putting the citizens first, is really heartening to see. That's great public service philosophy. I know that your sign over here, "We work for you," is kind of your guiding principle there, and it's great to see that. I particularly want to thank you for the Douglas County update that we receive every week. I don't know how long you've been doing that, but it's really helpful, for me anyhow, to get a one-stop shop of, here's a half dozen things or more of things that Douglas County is doing. How long have you been doing that?
So it's this, Commissioner, for those who don't know, it's just a newsletter I've done since, I think July last year. So.
Well, keep it up. That's really great. And that's available to everybody, right? That's post?
Yeah, I mean, I just email it out, but basically, kind of how I've started the list was just people I've helped over the years say, hey, I have this newsletter, would you like to be added? Or, on Twitter or Facebook, we'll make a post every once in a while and letting people know they just email me, I'll put them on the list. And it's usually just something I send out every Sunday or Monday. No opinion pieces. It's just, here's what's going on this week, and here's a list of kind of frequently sought after services that I can keep in every email, whether, birth certificates, marriage licenses, gun permits, stuff like that, just stuff that over the years I've noticed a lot of people ask our office about, so.
Right.
Yeah.
Well, it's a good additional service, and you and your staff do a great job of making government transparent and understandable at the same time. And to do it for, less is really amazing achievement. So kudos to you, and I think this is a justified request on all of those bases. So thanks a lot. Keep it up.
Thanks.
Commissioner Mike Boyle?
Yes, thank you. And excuse me, Dan, I did appreciate the misspeak, because that's what I do all the time. So it's almost as if I stepped into your head, and I knew exactly what you meant when you said it. So, but you do more for less. So I have observed that often. And the thing about Dan's office, when his staff, and from Dan all the way down and up, every time, even when they're out in the public, the folks who are working in his office know who they serve when the door opens and they see the taxpayer coming in. I appreciate that attitude. It just is terrific. So I want to tell you thanks for that kind of attitude. One of the things we probably, I know the raises that are mandated are something that you don't have anything to do with it, and the job steps and all the rest, those are things that happen, but I think one of the things that I want to mention is kind of something that I don't know that anybody really wants to discuss publicly, but I'm going to naturally bring it up. And that is, I think we ought to be looking seriously at how payroll is handled, there you go, handled in other counties of our size across the country. The programs that Marianne has brought back have really been successful. We just saw one today that was just dynamite. But I think we ought to look into it, because I think they'd be less expensive. We'd still have control, and there are counties that are benefiting from that service. And I ask that because I think we need to do something because of Oracle, and I know nothing about Oracle, so how to pronounce it sort of. But I think we ought to put that on the front burner, Dan, and see what we can come up with. And it may be a change that has finally come, okay?
Anything?
And I'd ask you and Joe to kind of sit down and don't arm wrestle, but sit down and talk about some of these things, and get Marianne's contacts involved and see what happens. And maybe there's some good ones, maybe there aren't. But I think we need to explore it. It's something we need to face, I think. Okay, thanks.
Okay. Thank you, Commissioner Boyle. Any other questions or comments? Commissioner P.J. Morgan?
Mike, I totally agree with you that, and we are talking about that, making sure we're looking at that as an option to go outside to a contractor, possibly on the payroll, as many corporations do. And my friend, I know, is supportive of at least looking at those kinds of options, as is Joe Lorenz, our finance director. I just want to also thank Dan for the good job he and Alan do every week at our meetings, and also the great message he just sent about his numbers and budget. We're really appreciative of that, and I think it shows tremendous responsibility, and we thank you for your good job.
Thank you. Any other questions or comments for the clerk? All right, thank you.
Yep, and thank you. I don't think I said thank you to Commissioner Boyle and Morgan. So anyway, thank you very much, everybody.
Thank you. Next is a presentation by our Douglas County Sheriff's Office on their department's fiscal year 21-22 budget request, which is about $242,646 in excess of their budget target. And here today is Sheriff Wheeler, I like the sounds of that. Sheriff Wheeler is here to present. Go ahead.
Oh, what's happening? No.
Oh, I should say that there's a revenue offset on that request of $164,374, so it actually is a $78,722 request. Okay.
Oopsie. Lost you. There you go.
Good morning, Commissioners. Tom Wheeler, Douglas County Sheriff. As stated today, we're here to present the Sheriff's fiscal 2022 budget request. As you're aware, the target that's been given to the Sheriff's Office is a flat budget over the previous year, plus previously approved wage increases. We believe that we've largely accomplished that with our budget that we're presenting, with two exceptions. And that would be to add some additional security around the city-county complex and add school resource officers. As Commissioner Borgeson said, the offsetting revenue that comes with our request brings our total budget increase to about a net of $78,000 more. With me today is Chief Deputy Wayne Hudson. He's going to offer a presentation on our request, and after that, we'll take whatever questions you may have.
Thank you. Good morning.
I'm getting a little older now, so I gotta wear my glasses. Good morning, Commissioners. The Sheriff's Office has submitted a fiscal year 21-22 budget request of $19,038,933. The submitted budget is $242,646 higher than a target budget of $18,796,287. The target budget represents a flat budget from fiscal year 2021 with only contractual raises. This proposed budget number comes with offsetting revenue of $164,374 from the Public Building Commission and from the Elkhorn School District. The net increase to the DCSO target budget is $78,722. This equates to less than 0.5% of our target budget. The areas in which we are seeking additional funds are in building security and school resource officer. As you are aware, Douglas County is currently building a juvenile justice center. The new facility will add approximately 100 cameras to our current 300 camera system. Having one person responsible for monitoring that large amount of cameras, responding to calls for service, monitoring the communication system, and dispatching building security personnel and sworn deputies to emergency situations is not best practice. To ensure that we maintain operational readiness posture, an additional building security officer will be added to our control room for our B shift and C shift. These two shifts represent the times in which we have the most personnel in our facilities. The Sheriff's Office will staff 8 school resource officers in school year 21-22, with a 9th in school year 22-23. A relief SRO is needed to fulfill contractual requirements when an assigned SRO is unavailable due to illness, ongoing training, obligations, and other forms of authorized leave. I'd like to remind the County Board that currently LB 51 is in the legislature. If it passes, it also requires more training for law enforcement officers. The target budget for fiscal year 21-22 is on par with past year's percentage splits, which is 92% personnel and 8% non-personnel. I know this board likes to take a historical view of our budget information. I have provided you a snapshot of 11 years of payroll versus non-payroll information. As you can see, we remain consistent with 92% payroll and 8% non-payroll. In regards to our staffing numbers, you can see that we only added 2 sworn personnel and 6 support staff to our overall staffing numbers since 2010. It is true that the City of Omaha continues to annex areas inside Douglas County, but our primary patrol populations continues to increase because there is more growth in the unincorporated areas compared to inside the city limits of Omaha. I will discuss that a little bit more later. As we take a historical look at our adjusted budget versus our revenue numbers, we can see that both have increased slightly at the same rate. Our adjusted budget increased 13%, or 3.2% annually, and our revenue budget increased 14%, or 3.5% annually. This slide shows our primary patrol population for 2019, 20, and 21. As you can see in this slide, our numbers are steadily increasing in the unincorporated areas of Douglas County. As we take a look at the population growth in the unincorporated areas, it is true that the city of Omaha is annexing areas. Since 1990, they have added just over 86,000 population to the city limits. From 2010 to 2020, there were 13,696 building permits issued for the unincorporated areas in Douglas County. MAPA uses a 2.6 factor for building permits issued. Based on what we know, approximately 35,609 people were added to the unincorporated areas in Douglas County. Approximately 17,329 were added in the last 5 years. I say approximately 35,000 and approximately 17,000 because MAPA uses a 2.6 factor even if it's a single home or a multi-building, such as an apartment complex. And checking with our county GIS yesterday, there's approximately 245 apartment complexes in the unincorporated areas. So our numbers are going to be very conservative. As we take a look at the next slide, we can see the growth areas in green, marginal areas in tan, and declining areas in light pink. A lot of the growth areas are in the unincorporated areas of Douglas County. A lot of your marginal to declining areas are in the city limits of Omaha. In summary, we're asking the county board for a budget of $19,038,933, which is $242,646 over our target budget The net increase to our target budget would be $78,722, which is less than 0.5% of our target budget. The additional funds will be used to ensure we maintain certain security posture in our facilities and we provide school resource officers to the requesting school districts. It should be noted that at the end of fiscal year 2021, the Douglas County Sheriff's Office will have achieved 26 years in a row of coming in on budget. This shows that we are being fiscally conservative, we are good stewards to the taxpayers' dollars, and that we put our needs before our wants. With that, I'll answer any questions you may have.
Thank you. Any questions for the Sheriff's Office? Commissioner Kavanaugh?
Just one quick question. On this Elkhorn School Resource Officer,
Yes,
are we compensated by the Elkhorn Public Schools for any portion of that?
we are. They pay half of the total salary, benefits, everything.
Thank you.
Any other questions for Commissioner Mike Boyle?
Yes, Captain, thanks. I want to ask about the number of deputies that are presently working for Douglas County and what they are doing. Do you have records of that?
We do. We can break our sworn down by bureau. So right now we have 135, and I can provide the commissioners exactly where all those sworn personnel are at.
Okay, I know that there's a mandate that you provide service for the courts, and
Correct.
years ago, the building commission was going to set up its own private or separate security system, and I kind of did my usual thing and said, no, we should use the sheriff. And so it makes a lot more sense because if something happens in the courthouse, all of you are on the same frequency and there's no confusion about what goes on and the procedures are standard. So I know that I contributed to the increase in number of deputies in the courtrooms and in security, but that's important. So I really want to know the 135. And then do you have any records of calls for service?
We do. Are you talking about a historical view or just for a certain time period?
I'm sorry, historical or what?
How long of if you tell me how long of a time period you want, I can provide that information.
Well, I guess I'd be curious. The last a couple of years anyway, 2 or 3 years of when someone calls 911 and they end up being referred to the sheriff, what's the purpose? And I'd like to know that. I have talked to 911 and gotten some preliminary figures occasionally, but I think it'd be important if you could tell us what the purpose is. And also, in line with that, Commissioner Duda always complained about no service in his area because of where he is, way down on the Missouri River. And I was wondering whether you can tell us about the practicality of what you think about continuing to try to serve that area from wherever it is the officers are coming from. You might want to take a look at that and see if you can defend it. I'd be curious. Also, if you have, I asked Marty Bielik for this years ago, and kind of got some straight lines from the Elkhorn to the Missouri. I said, what are your territories of service? And he just drew some lines straight across everything, including the county and the city. And I've never had a sheriff respond to a 911 call in my neighborhood. So I think we ought to be thinking about doing that. I think it'd make more sense, but they're trained, they're well-trained and all the rest. So I'd like to see your service territories. How do you determine, how does 911 know to who to call when someone calls from, one of the areas inside the middle of the city? How do they refer it, and to whom do they refer it? And maybe that's a 911 question, but I'd like to see that. I think it'd be important.
I can answer that question, your last one, if you don't mind.
Okay, go right ahead.
We just redistrict our boundaries to make it more equitable as far as how many calls for service for a certain patrol zone. So you mentioned Commissioner Duda. So I can tell you exactly what the population is for that patrol zone, and then the time it takes for our deputies to get to those priority calls. Now, one other thing to remember is that we have a memorandum of understanding with the Omaha Police Department. So if with a priority one call comes out and their cars are closer, even if it's in a county, they will respond. And the same thing, if there's a priority call in the city and we are closer, we will respond to that call. So we work really good with the Omaha Police Department on that matter.
You know, I'll tell you the truth. When the city was doing a lot of annexation and Hal Dowd was mayor, I contacted Hal and I said, I suggest you keep up the sheriff patrol in some of those areas. The people really like it. And I think that the sheriff would be amenable if you asked him to do a contract with the city. And that's kind of where he really got pretty aggressive. And I know there's a
1 minute
service agreement, but those are kind of important things. And I also want to ask you to sometime, not today, we're running out of time, but I'm curious about no-knock warrants. I think we need to get that out in the public and if we're doing those anymore and what the procedures are. So I look forward to your answers, and I'll probably be in touch through email with you. Thank you very much, Captain.
Thank you, Commissioner.
Commissioner Maureen Boyle.
Thanks again for coming to speak with us. First, I want to mention also that you kind of have a little bit of a tough act to follow with the clerk saying that he's under budget and actually seems to give back money. So you've said you're at budget. So so anytime we increase, it seems like it'd be nice to get money back from the different departments at various times, just to make that fiscally conservative comment. The other question I have is that the Juvenile Justice Center, it says that you'll have some additional expenses due to the 2 additional building security officers to look at all the cameras. I don't believe that's not going to open until 2023. So
correct.
Are we hiring the 2 additional officers, building security officers now for something that's in 2023? Could that wait for the budget for the following year and save, these $80,000 payroll for 3 people there?
I would say right now, we still have 300 cameras right now. And industry standard says that it takes about 15 minutes to watch a camera before a security person's mind starts to wander. So we have 300 cameras and all the other duties and responsibilities for one person. So we want to hire them now and put them in the control room now.
So how many, just for my information, how many officers do you need, like, say, per camera?
I don't know if it's a per camera officer ratio. I can probably find that right now, find it later on. But ideally, if you got someone watching the camera, then if there's an emergency situation, the other person should be on the communication devices and telling the deputies or the building security personnel what's going on. Right now, that's one person doing all that work.
For the one person for the 300 that
Correct.
you've got now? Okay, all right, thank you.
Thank you.
Any other questions for the sheriff's office? Okay. Well, thank you. Oh, Commissioner Friend, did you have a question? Oh, okay, I thought you, okay. All right, well, thank you very much.
Thank you.
Next, we'll go to administrative services, and we have one agenda item, the discussion/approval of Field Club parking lot addition, and Jerry Leahy is here to present.
Good morning, Commissioners. Jerry Leahy, Public Property. I had emailed Commissioner Boyle a week or so ago to advise him of the request from the Field Club to do some improvements, in this case, a expansion of a parking lot. And with our lease with the Field Club, anytime they do any improvements, they have to come before the board and either explain the improvements or, in this case, the need for an addendum to the original lease. So the general manager of the Field Club is here today, Greg Gilg, if you might have questions for him, because he may be a little more informative of the project than I am, but we need your approval today to get this project moving forward.
Okay. Commissioner Mike Boyle?
Well, Jerry's kept me very, very well informed of this, and I have heard from others, and I just want to say this is a very needed project, and that we should move forward with it if anyone's interested. And I'm sorry, Jerry Leahy is going to buy the fellow lunch at the Omaha Field Club. But anyway, thanks a lot for coming. Sorry you're here so late, but I think it's a very good project, and I recommend approval.
Okay, that's, is that a motion, Commissioner Boyle?
Yeah, yes,
Okay.
yes, it is.
Is there a second? Well, actually, Commissioner
Public
Rogers,
hearing.
yeah, Commissioner Rogers making the motion. Is there a second? Commissioner Maureen Boyle. Any other questions or comments for Jerry
Thanks, Mike.
or Commissioner
Thanks, Jerry.
Boyle? All right. Seeing none, please vote.
Voting yes.
Thank you.
Yes.
Thank you, Commissioner Mike Boyle.
Hey, thanks, Jerry. You're doing a great job, always. Always.
Thank you.
Motion passes 7-0. Commissioners Mike Boyle and Morgan voting virtually, other commissioners voting in person.
Okay, thank you. Next, we'll move to Human Resources. We have a weekly personnel report from Civil Service as presented, unless someone has any questions. We'll move on to the legislative update, and today we have a particular update on LB 644, which we will refer to now as Amendment 1019 to that. And Marcos is here. I know he ran through the detail yesterday. He sent out the information as well. But Marcos, do you want to just do the brief executive summary of what we're looking at in 644, please?
Sure. Commissioners, Marcos San Martin, Douglas County Labor and Legislation. So the only item that's before you today, it's LB 644, also known as AM 1019. The current form of that bill, it's the title of it, it's Adopt the Property Tax Request Act, change dates relating to tax levies, change provisions relating to property tax refunds. You know, and just to make it very brief, because I did send out a pretty long summary to all the board, and I know I went over it yesterday in the pre-board. You know, this bill essentially establishes a I would say, like, builds into the statute a trigger mechanism to where if the board's tax request or any political subdivision's tax request, a county, a city, school district, community college, wanted to exceed 102% of their prior year's tax request, they would then have to comply with a number of requirements under the bill, such things as having a joint public hearing, sending out a postcard to all affected taxpayers with some really taxpayer-specific data. The joint public hearing would have to be, together with the other political subdivision that is also exceeding its 2% tax request, would have to be held after 6 p.m. on or after September 17, but prior to September 29. Those political subdivisions participating, they'd have to make a presentation, anyway, and then eventually pass an ordinance or resolution, approving that tax request. So if the board has any additional questions for me, it is pending in the legislature, on select file. We believe it's going to move forward. And yeah, so I'm here to answer any other questions.
Thank you. Commissioner Mike Boyle?
Yes, first, thanks a lot for keeping us so well informed on this particular subject as well as the others. But I do want to ask, I think maybe what we ought to do is send a letter to I don't know, at least the Douglas County area, maybe all of the state senators, and point out that if we do this, I think we have, correct me if I'm wrong, but I think we have 13 school districts in Douglas County part. So I think we have 13 school districts that come in even from Fremont. And so we'd have to have all of them present along with, everybody else, the cities, the towns, Waterloo Valley and Omaha and all that in one place. I don't know, this might work in Ong, but it doesn't work in Omaha. So I really don't think they're excited about trying to put the blame on us, and, maybe some state mandates we could talk about a little bit too here, which is Marianne has got a list of those that goes forever. But anyway, I really think we ought to notify them that this involves probably, I don't know, 400 local agencies getting together in one place, and a postcard, all of those taxpayers. I mean, this is insanity.
So it's only those entities that go above that 2% have to be at the table, and it is, you can have a representative from each one of those entities, so it doesn't have to be the full board of whatever jurisdiction is going to be meeting.
Well, I didn't know that part. I wasn't available the last few days. So anyway, I just think it's time. We need to do something and let them know that we're not really devils, that we are doing God's work here, and they're the ones who are spreading the work, and we're happy to accept it, but just don't complain about it when it costs.
Right, exactly.
And Commissioner, to tell you a little more about it. So yes, we do have a lot of school districts, a lot of political subdivisions that would be subject to this. Yes, it is only those that would be exceeding 102% of the prior year tax request. Now, those school districts that do overlap into Douglas County, as the bill is written, they would be subject to their, to say their principal county's location. So an example would be like provided in the bill, Arlington schools, way up in northern part of our county, their primary district is in Washington County. So they necessarily wouldn't be showing up, here in Omaha, just as an example. So yes, there are quite a few, but maybe not as many as you may think that there are. But yeah, there are quite a few.
Commissioner Boyle, go ahead.
Well, I only say I guess that means that the taxpayers in Arlington who live in Douglas are not represented then. That's kind of nice. I guess I have to figure out where they're supposed to go. I just think that's as we all know, this is one of the dumber, we should make a movie of it, Dumb, Dumber, also. So anyway, I just can't get it. I don't know how we always end up being the enemies, we're the enemy. I just don't get it. But anyway, thanks.
Well, Commissioner Boyle, you missed my comment yesterday when I asked the state if they were going to send out a postcard and hold a public hearing with us on the unfunded mandates that they're sending down to us. So, of course, there was a negative response on that. So, But anyway, this is on final reading. I think it's, again, kind of a foregone conclusion. There was conversation. Marcos, did you have that language that you and I talked about the other day, just to throw it out there, about a 10% max on a 3-year period?
Well, I think that.
Or is it too late in the game?
Well, I don't believe Douglas County wouldn't be the one to introduce an amendment like that. I don't think that wouldn't be beneficial to the county, I guess.
Okay, all right. So anyway, I just wanted everybody to be aware that this is coming, and again, it's an unfunded mandate. While, the debate that was centered around this was pretty awful. It slammed about every local jurisdiction there was to slam on us pretty much being spendthrifts and not being open and honest and transparent with our budgeting process. Perfect example today, we had 2 departments and offices up here telling us about their budget, and we have open public hearings on our budget, so I don't really understand where they think or what we're trying to hide. But anyway, just wanted you all to be aware of that. The governor did sign the budget without any vetoes last week, and there was also LB 64, which will phase out the taxation of Social Security benefits over a 10-year period at a cost to the state's general fund about $100 million per year. They really downplayed that cost during the debate, but again, there will not be that taxation on Social Security, which is a good thing. Let's see what else. And then we talked about LB 644, which actually is turning into Amendment 1019. And then Senator McAllister's LB 108, which changes the provisions relating to the SNAP program, the Supplemental Nutrition Assistance Program. And that passed. And the deadline for interim studies for this session is May 19th. And there's one other consent calendar, which again is going to have a fiscal impact to the county, and that's LB 407. It's Senator McDonald's. And it includes that certain county correctional officers and provisions governing mental injuries and mental illness under the Nebraska Worker Compensation Act. It expands worker compensation for mental injuries and mental illness for correctional officers only in Douglas County and Lancaster. So again, that's on consent for this week. We will continue to keep you updated on those individual legislative items that will have a fiscal impact on the county. We're gathering those that have already passed, and we'll hopefully have something to present next week as a preliminary, but we'll go on and watch those as we move to the end of this, move towards the end of this legislative session. So with that, that's the update. Larry?
Thanks again.
Yep.
Larry Store, 5015 Lafayette Avenue. Omaha. I found the other article, and it has to do with the county as well as state governance. I'd like to start
Larry,
off.
we're on legislation.
I know.
So that
I know. Would you please not interrupt me? I'll explain why.
if this has to do with the
Okay.
legislation, or I will stop you.
Yeah. Do I have to have a specific piece of legislation?
No, it has to do
All
with
right.
legislation.
I'd like to talk about some legislation that I'd like to see down there if it's not already there.
Okay,
Has to do with elections,
okay.
if you don't mind.
Go ahead.
Now, you made a comment about you don't know what we're thinking that you're maybe hiding from us. Well, maybe we think that because we don't know a lot of what's being said. Now, here's an article from just across the river, right here in River City. You want to know why I get upset? I get interrupted. It's my time, 5 minutes, and I get interrupted. Okay, Iowa officials coordinated with big tech to censor election posts. Judicial Watch sued them. They've won their case. But the government in Iowa doesn't want it, the election people. Some were elected, some were nominated or what, I'm sorry, just put in there. But they don't want to answer the questions even to the lawsuit. Because why? Because they were probably fiddling with the election process. And there are citizens all over this country extremely angry and still believe that the election was in fact stolen. Now, I was born in 1943, and I can't for the life of me figure out why, after all these years, our trusted election officials can't get it right. They can't protect the election from having unsealed voter rolls or more people on the voter rolls than there are living in the county. This particular lawsuit had to do with 8 counties in Iowa. Do I think that it's not possible in Nebraska? No, but I think citizens need to get the truth, and it needs to be stopped. This is yesterday's Epic Times newspaper. Yes, it's not the World Herald, but it's a growing, very growing popular site. Judicial Watch is a very popular organization. Secretaries of state are involved in this. That implies the Association of Secretaries of State is also involved in this. That implies that there's more than one state, more than one Secretary of State. And I know Marianne and some of the other politicians go around the country to these associations of secretaries of whatever, local officials, county governments, city governments. Those are people that we don't know what they're actually talking about. That's why we are suspicious. Thank you.
Dan?
Dan Esch, County Clerk, if you wouldn't mind going back to 644, and I guess a question for maybe Commissioner Friend, since he's actually been a senator, or Commissioner Morgan, or Commissioner Borgeson, is our longest tenured person on the board, or Commissioner Kavanaugh has been served, been down the legislator as a lobbyist. At this point of the game, is there anything to do when it's on final reading? And here's why. And I don't think it's an effective argument, judging by the comments I've heard in the debate, and I don't like using words like, oh, it's a disaster, oh, it's a nightmare. But I actually think it is okay to say this creates a logistical nightmare. Mm-hmm. Joe and Sherry Alban and I can tell you, we have a hard time getting budgets and tax rate information from the other political subdivisions right now. Mm-hmm. This bill creates such a short window. And in some cases, if people took full advantage of the length of time, that joint meeting's on the 29th, that means we need to get everything the next day. I'm not confident at all that that's going to be even possible. Mm-hmm. And I've never complained and never said anything to other senators, because just judging by the talk on the floor is, well, I'm going to come off like I'm complaining that I have to work. You know what I mean? Which is obviously not the case, but I don't know how to say that without coming off like I'm, oh, you're making it too hard for me. But, I'm just trying to be realistic about some of these timelines this bill establishes, and it's going to be a challenge. I'll just say that. And so I don't know if there's any advice at this point when something's on final reading, if there's really anything you can do to stop it. But,
and Dan, all those points that you brought up have been brought up.
Yeah.
And it fell on deaf ears, period. I mean, really, seriously.
No, I hear you. Yep.
And I don't like saying things are a disaster or calling out, like the sky's falling. Yeah. But this is a disaster waiting to happen. So I completely am with you and understand on that. Commissioner Mike Boyle?
I think, Dan is absolutely right. He's not a not one of those people, but and neither are we for that matter. But I think what we should do is just be prepared to notify the people who brought this on. I don't know who it is that we're supposed to report to, but tell them that we have not received the reports and we cannot provide the information they ask for. That's it.
Right.
I mean,
Right.
there's nothing else we can do. We didn't get the information from Elkhorn or wherever, you know?
Yep.
So I think we just have to be, that's what I'm saying. It's just tell them we don't have the information. We're sorry we are unable to comply with the requirement.
Yep, I agree. All right, with that, we do not have need for an executive session. And so do we have a motion to adjourn? Motion by Commissioner Maureen Boyle. Is there a second? Mike or Jim? Second by Commissioner Mike Bren. Please vote.
Voting yes.
Commissioner Boyle?
Yes.
Yeah, I apologize, Commissioner Boyle. Did you vote yes as well?
Voting yes.
Okay.
Me, yes, too.
Commissioner Kavanaugh? Okay. Motion passes 7-0. Commissioner Rogers, Morgan, and Mike Boyle voting virtually. All other commissioners voting in person.
And we got sidetracked. I do want to take a point of privilege here at the end of the meeting to, I do not feel the same that Larry did about our elections. We had a fair and very trustworthy election process, so thank you.
No, I agree totally. And it's bipartisan. This sort of skullduggery is not taking place. So really, calm down. Calm down. Just pay attention and vote. That's what you need to do.